Hello, everyone. I just want to thank you for coming to the symposium today. We're really excited about our event, and we're going to be in for a special treat today. We have presentations from amazing faculty members at Oakwood University, as well as our honors students and our STEM and psychology students. They will be presenting poster presentations today. I am Dr. Elaine Vanterpool. I am the chair of the Department of Biological Sciences, and I'm also the chair of the Faculty Research Symposium. We're going to go ahead and get started with prayer. Bow your heads. Dear Lord, I just want to thank you for allowing us to be here today. I just want to thank you for every individual that is streaming in today. I pray for every presenter, every person that is on the program. Thank you for all the many blessings that you have done for us. We pray. Amen. I would like to welcome our amazing president of the Oakwood University, Dr. Leslie Pollard. He will give us our welcome, and we are looking forward to what we have in store today.
Thank you. Thank you. Well, good morning. I better back up. So, good morning, everyone. We certainly welcome you. I am here in the Faculty Research Symposium and very grateful for this opportunity to welcome you to one of the core works of faculty. When we think about faculty, we think about teaching, we think about teaching, we think about research, we think about service. We think about that three-legged stool that faculty members actually need to sit on in order to make sure that their service is not only memorable, but impactful. And here at Oakwood University, we are very much committed to the Faculty Research Symposium and equipping and empowering our faculty to make a contribution to the body of knowledge under the discipline in which they are functioning. Oakwood has a long history of working on matters of research, of trying to bring new light, new understanding, new revelations, new insights into bodies of knowledge. And we want to welcome you. For the faculty who are here in person, as well as those who may be away, who may be participating via StreamYard, welcome. Oakwood University is a place where knowledge increases every single day, always in service to the mission of this great institution. So I welcome you. It's my pleasure. I'll stay as long as I can because I'd love to hear some of the presentations. So may God bless you. And again, welcome to the Oakwood University Faculty Research Symposium.
Shout in triumph, praise the Lord, shout for joy, sing. What a beautiful way to worship through song. We have now come to the point in the program where we will hear from our keynote speaker. After the keynote speaker, you will hear a response by Dr. Sudiel Hawkins, Vice President for Faculty Development and Research here at Oakwood University and an Associate Professor in the Department of Management in the School of Business. Our keynote address will be brought to us by an alum of Oakwood University. Each symposium or symposia, we bring forward what we call the products of Oakwood University. And Dr. Fidoria Ruggles is one such person. Dr. Fidoria Ruggles was born in Michigan, but also claims the states of Alabama and Tennessee as home. In 2007, Fidoria received her Bachelor of Science degree in biomedical sciences with honors, along with minors in both chemistry, and here's an interesting piece, and music. She received that degree from Oakwood University in Huntsville, Alabama. She went on to continue her educational pursuits at the University of Cincinnati's College of Medicine, where she was a Yates Scholar, a fellow in the Molecular Epidemiology in Children's Environmental Health Training Program, and she graduated with her PhD in Molecular Epidemiology in 2012. Her research interests have spanned from studying exposure effects and neuromotor performance to patient-centered outcomes, cancer research, and HIV behavioral surveillance and community-based participatory research. She has presented her work in several publications and at various conferences nationally and internationally, which include the American Public Health Association's annual meeting and also the Center for Environmental Genetics Regional Showcase. She has also presented at the International Association for the Study of Lung Cancer and the American Society of Clinical Oncology's annual meeting, and numerous other conferences. We surely can say that Dr. Fidoria Ruggles is a published scholar. She has contributed to her disciplines, and you may, of course, Google her or visit her profile on LinkedIn to connect with Dr. Fidoria Douglas. Fidoria also has a passion for education and is an adjunct faculty at various institutions within the Southern region. I would like to tell you about some of her extracurricular activities. She loves to consult. She loves to work with organizations. And remember, she has a minor in music as well as chemistry and a degree in biomedical sciences. So you will not be surprised that her interests are varied and reflect the right and the left side of her brain. Some of her extracurricular activities include things like event planning, mentoring, traveling, and playing and teaching the piano and singing with various musical ensembles, including the Memphis Symphony Chorus and the Mississippi Boulevard Christian Church Sanctuary Choir. She is truly a diverse woman with multiple interests, and we will hear her brain at work in today's keynote address. Dr. Ruggles serves in a dual role as the Director of Research at Church Health and a Research Assistant Professor at the University of Memphis College of Health Sciences, which of course encapsulates her passions and areas of service in the healthcare, research, and academic areas and arenas. In this role, Dr. Ruggles oversees the Healthy Memphis Initiative and works as a liaison between various investigators, university faculty, and students, along with the community partners and organizations, with the goal of building a strong, nationally recognized and collaborative research program with networks that enhances community-based and clinical work being done both locally and with a model that engages research organizations with community and community health. Dr. Fidoria Ruggles has been named in the Memphis Business Journal's Top 40 Under 40, a new Memphis Institute Leadership Fellow, and she's also an American Heart Association Mid-South Woman of Impact. Fidoria is now transitioning into a new position. That position will allow her to be responsible for providing direction and oversight for efforts to improve the health and well-being of the Anthem Health Plan's membership. Ultimately, she has a strong love for people, a desire to reduce healthcare disparities within underserved populations, and a burden for all to obtain holistic, optimal health and wellness. I am pleased to introduce to you an alum of Oakwood University who embodies the motto of this university: enter to learn, depart to serve. Dr. Fidoria Ruggles, your alma mater, welcomes you.
Thank you so much, Dr. Pollard. It's truly my pleasure and privilege to be here with you all this morning. This is definitely, truly a full circle moment for me. And so I'm honored and delighted for this privilege to be here with you all today. So I'm going to share my screen. I think we're good now. Everyone can see. Yes. All righty. Thank you all so much. Appreciate that. So I've been asked to share some of my research and work that I've been involved in both the Church Health and the University of Memphis side. I will start as a pretext to this that this is not necessarily your traditional research that some of you all may think or may be familiar with. So a lot of times we talk about things that are done in labs or under the microscope or things of that nature, but I'm more of a boots on the ground person. As you would see it, I love to be in the trenches working for my people. I want that whatever work I do and whatever impact I have, that's ultimately going to make a difference for my people. So this is a different research approach. As Dr. Pollard mentioned in the introduction, that it's more of a community-based, participatory, and impact type of research. So I'm going to give you a little background as to the area and then dive into some of the work and efforts that we've been doing. So the title is entitled Bridging the Research Chasm Through Collaborative Integration. So a little background: where I'm located is Shelby County, Tennessee, which is Memphis, Tennessee, primarily is the metropolitan area. And it's made up of a population of close to 1 million people. It is the second largest county in Tennessee. A lot of times people think here within Memphis, we call Memphis its own separate state within the state of Tennessee because it's so drastically different from the rest of the state of Tennessee going eastward. It's about a little over half percentage of African-American, 50% African-American. We do have increased Hispanic population now. And then we also have about a 12% uninsured population. And this is a certain niche and area that I'm going to focus on in some of my presentation today. A little background on the University of Memphis. It's founded back in 1912 as West Tennessee State Normal School. This is a little bit background on the campus size. The biggest thing is that I want to share with you is that we have about 2,500 employees and over about 22,000 students. I'm giving you this background to share with you some points when it comes to the collaboration piece. Next, a little bit of background about church health. So I'm going fairly quickly. I have my phone timer set. I was told I have 45 minutes and I have to get through all of these slides. So I'm going to make sure I stay on time with my timer and stick to the schedule. So Church Health is a charitable clinic. It's serves the free. It's a free charitable clinic that serves the underserved population, the uninsured and the underserved population here in Shelby County. It's been around for over 33 years, and it is primarily focused on giving whole person care to those residents who are unable to have access or financially able to afford to get that quality level of care. Our patient population has shifted some, but primarily we are serving patients of color, especially in the Hispanic and African American community. We average about 62,000 patients per year. So, my bosses, as I like to call them, the CEO of Church Health and the president of the University of Memphis, like to have breakfast on occasion. And while at breakfast one day, they came up with this novel idea as to how both institutions could help each other and yet also benefit from a shared collaboration. And so we realized through some of this conversation that both the university and Church Health Center had shared vision and goals. And ultimately, we felt that this partnership would enable the University of Memphis faculty, staff, and students to have more of a community presence as it is located in the heart and middle of the city. And then also for Church Health Center to have more of a research backbone within its clinical infrastructure to help support the engagement and things that the clinic was doing. And so when putting that shared vision and goals together, we developed this mission statement, which is to develop the strong partnerships and commitment within the Memphis metropolitan area that provide improved experience in the care, life, health, and well-being of the population by pursuing new knowledge through integrative collaborative research, along with interdisciplinary study and discovery beyond our walls. Ultimately, that this is not just limited to our buildings, but we're taking this work out into the streets and into the community, and therefore impacting lives. With that, we said, okay, well, each institution can benefit. So the University of Memphis benefits because it now has unique partnerships for proposals and grants. We're now able to do translational research, pairing of faculty and students and graduate students who have similar ideas of areas of research and impact. And then we're able to disseminate our work and then link with other organizations, ultimately to improve our local health outcomes. This also, the biggest aspect of this is the community impact, which has to do with achieving health equity through trusted collaborations, direct services and partnerships, improvement in the outreach and management of our community resources. We have targeted collaborative research programming that addresses the healthcare disparities and communicable diseases within the community. Ultimately, we want to reduce our chronic diseases. And a big thing now is our social determinants of health, and then ultimately improving the overall health of Memphis and Shelby County residents. So everything that we do needs to be measured. Okay, so it makes no sense to do anything if you can't show your outcomes and proof that what you do works. So we wanted to make sure that we also have quantifiable outcomes in all of our work. So we want to improve our practice and delivery of care, also increasing our capacity to serve others within our collaboration and patient population. And then we want to create and grow these collaborations to more of a nationwide level as well with other research institutions and other organizations and universities, and then increase our dissemination efforts with other contributions as well. So we have three main goals. What we have created was now termed the Healthy Memphis Initiative. And that is what I lead and have birthed and given oversight to. And so there's three main areas that we had goals with. One was to develop a nationally recognized collaborative research program between the University of Memphis, Church Health, and other institutions with a focus on community health research to now be a bridge of collaborations between various researchers and investigators on different projects, ultimately improving our health and well-being of our residents. And then to strengthen and consolidate existing relationships, as well as expansion to other areas, departments, and schools. A lot of times we tend to work in silos. Everybody is in their own little corner doing their own little thing. But imagine the goal when people are able to come together and work together. You have a much broader impact and range of impact that you're able to achieve. So these were our 3 main goals of the initiative. So I mentioned earlier that the initiative started out with just 2 organizations, University of Memphis and Church Health, but it has expanded to include other organizations. So these include Christian Brothers University, the University of Tennessee Health Science Center, Baptist Memorial Healthcare Center, which is a local hospital. Our local hospitals, both Baptist and Methodist, Rhodes College, and Crosstown Concourse, where Church Health is housed. And I'll talk a little bit about Crosstown later on. But there are certain tenets in which have to be included within this initiative. One has to do with representation and relationships. So we have to ensure that everyone has a seat at the table, that no one is excluded. Next, there needs to be an exchange of knowledge. If there are people that are coming together with different areas of expertise, we want to make sure that there's a continuous flow of knowledge exchange based on those different areas of expertise. Next, we want to have the opportunity to co-create. So if we're bringing these individuals together, we want to be able to come up with new innovative ideas and approaches to the work in which we're doing and come up with that together. So the element of co-creation. And then lastly is translation. We want to be able to take this knowledge and these ideas and these concepts that we've created and now be able to instantly implant them within, whether it be the clinic or where other areas of the population, to translate that knowledge into our practices. So our strategic focus has 3 main areas. First is innovation. Then we want to elevate what we've learned and then accelerate that, I mentioned earlier, in a more rapid way. So we don't want to sit on this knowledge. You know, knowledge becomes old, research becomes old very quickly. So we want to be able to immediately implement what we have learned and the research that we have developed. So a little bit of background as to Church Health. Church Health has several areas. We kind of call it a one-stop shop that you can come for all of your healthcare needs. So we have a medical clinic, which serves our primary care mostly. We also have an urgent care where people can drive up and who have more emergent needs. We have a family medicine clinic as well, serves family care and pediatrics. We have physical therapy, behavioral health, dentistry, optometry. We also have what we call our Nutrition and Culinary Institute, where we teach people healthy eating and living. I'll talk about that in a second. Perea, which is our preschool, and we have what we call the Well, which also is child activity and care. And then center to everything that is done at Church Health is the model for healthy living. And some of you all may look at this and say, this looks like New Start. Well, it is exactly very similar to that. So we believe that we have to have a strategy for the entire person. We call this for whole person care. So it means your faith life, your medical, your movement, getting exercise, your work life, your friends and family, your emotional health, your nutritional health. All of that plays a part in that whole person. And we want to make sure that we are focusing on all of those needs to ensure whole person care for our population. So Church Health takes up about 1/3 of this building that we call Crosstown Concourse. And Crosstown Concourse is a historic building. It used to be the huge Sears Tower that was built long ago in the early 1900s. And so it has been revitalized into a urban village, which contains apartment living. It also contains businesses, stores, retails, restaurants. It's a very thriving community, and Church Health takes up 1/3 of that. Well, because of that, we also are able to partner with all of the areas within Crosstown Concourse. So a lot of our impact efforts can be partnered with the Crosstown community. We also have a Crosstown Church Health YMCA. There's also a high school in the building, Crosstown High. And we also have Crosstown Arts and Wellness, which has to do with theater, music, photography. And then we also have banking and financial literacy, teaching people how to budget and how to manage their money and steps towards ownership and things of that nature. So we created what my CEO likes to call the Hive, in which you're able to bring together people from various disciplines, various backgrounds, and create what we call a think tank. So this gives us the opportunity to come together to brainstorm. It increases collaborations. You come up with new ideas, and then you have a production of studies that can then display your outcomes in a very strong way. So this was started, and it brings together faculty from the various university, graduate students. It brings together the directors and leadership within Church Health and other community organizations, and we put them all in the same room at the same time. And as a result, we're able to develop new projects, new ideas, and concepts to be implemented. So this picture was taken pre-COVID, and we were meeting quarterly at that time to come together and do follow-up. We shifted virtually, but recently we are now back to in person. But this is an example of our Hive. So within our Hive, we have 4 main task forces to kind of center and focus our work. One is fitness and wellness. Another is student engagement. Another has to do with data, methodology, and analysis. And then the last one has to do with community engagement. And within each of those areas, we have champions that are led by our faculty to kind of focus in on those main areas. So to date, this is kind of an update as to a number of projects that we've completed. I'm currently overseeing about 30 projects, some others that are in the pipeline, and other collaborative projects that are not necessarily research related, but that are still doing a community impact. We have manuscripts, abstracts, and publications as well. So I'm going to highlight some of these projects that are in progress and publications to kind of give you a snapshot of how varied the discipline can be, but also how community-centric that it is as well. So the first one on this chart is entitled Echo Charitable Clinics. And this is a partnership to measure the effects of charitable care on cost, quality, and access when introduced into metropolitan and rural areas. So part of the goal within the Church Health was to take it as a model that it can be expanded on a nationwide level. So to prove that not just what we do here works, but it can be replicated in other areas. So ECHO is the tool that we're used to do so. So in this experiment, this charitable care experiment, the goal was to measure the effects of charitable care on cost, quality, and access when introduced to metropolitan and rural areas. So the study design of this is a strategic nationwide study. We have about 6 clinics that are involved in this study. Can you go to the next slide, please? I thought I was controlling slides, but I guess I'm not. Thank you. There's a 3-stage overlapping study. And so clinics within the client network, also local hospital systems near the clinics, are you able to compare metrics among communities with similar demographic and socioeconomic conditions? And so we want to look at several areas when it comes to the economic aspect, the community aspect. So in the economic aspect, are we saving the healthcare system money by the presence of the charitable clinic when it comes to certain hospitalizations, ED visits, things of that nature? Then the impact that it's having on the community and that healthcare in that area, and then patient-centered outcomes when it comes to chronic conditions and quality of life and things of that nature. Okay, this is not my next slide. Okay, thank you. Okay, I hope we're not going from 2 different versions, but across 5 states that we wanted to start looking at when it comes to some of the breakdown of demographics, racial, ethnicity, the chronic diseases and things of that nature, we start to delve into the different aspects within each clinic. So this graph shows you when it comes to our different demographics, we learned that a large percentage of females utilize the charitable clinics as compared to men. And so this also shows us that we can provide evidence for the conclusion that the impact of the free and charitable clinic Two, women also will have a generational ripple effect, as their children are also able to see their mothers utilizing preventable and primary care services, thus instilling good health habits and closing the gap when it comes to behavioral health and disparities. So you can see here we have our 6 clinics. Well, these are 6 clinics within, one is in Bethesda, which is outside of Tyler, Texas. The second one, of course, is Church Health in Memphis. The third one is Community Health in Chicago, Illinois. The next one is Good Samaritan, which is in Atlanta, Georgia. And the next one is St. Clair, which is outside of Birmingham in Pell City, Alabama. So we tried to target different clinics that are located strategically throughout the U.S. They have a similar demographic makeup and citywide makeup as well for points of comparison. So we also want to make sure that our population is representative of our city or metropolitan population as well. So we did an insight into the populations identified as minority races and ethnicities. So moreover, for these minority populations, our free and charitable clinics are taking on a comparable or greater percentage of these patients relative to their respective cities' demographic breakdown of race and ethnicity. So from this data, we can provide evidence for the conclusion that supporting the impact that the free and charitable clinics contribute to the health of minority populations, particularly minority individuals that come from low-income zip codes as well. Then we can also make a extrapolation that these free and charitable clinics are also making a significant contribution in order to reduce barriers in healthcare and promoting cultural competency through this care, especially among this population. Okay, so this is a breakdown of our population of patients, and we want to make sure that we were targeting some of our low-income zip codes. So what you see shown here, I'm doing a comparison between Memphis, Tennessee, and Atlanta, Georgia, which are 2 of the similar metropolitan areas. And we can see that the majority of our population within these lowest income zip codes are what? Are Black and Hispanic people of color within these populations. So we are on targeting that. Okay, we are supporting this conclusion that we are making an impact on the health of these minority populations, particularly those coming from the low income zip codes, and that these zip codes are among the list of some of the highest poverty rates in that clinic's respective cities. I'm going to keep going. Also, these clinics that I'm showing have developed and grown over time, and so too has their impact. And I'm going to show you a comparison with one of the clinics, which is St. Clair, is the most recently founded clinic. It was founded in 2018, and we wanted to look at the radius of impact within each clinic. This particular clinic has currently an impact radius of about 35 miles. Well, as clinics have developed over time, their radius of impact has expanded. So you can see, for instance, this next one over here in Bethesda, which is in Texas, that was founded in 2003, now has a radius of impact of 326 miles. On this next one, you see Good Samaritan, which was founded in 1999 in Atlanta, Georgia, has a radius now of about 815 miles of impact. And then Church Health, which is the oldest one, founded in 1987, has had an impact of over 1,700 miles. So this positive relationship between the length of time in operation as a free or charitable clinic with this radius of care provides the evidence that we also needed of sustainability of the free and charitable clinic. So there's an overall trend of an increased radius of impact correlating with increased time since the clinic was founded. So in other words, the longer that a clinic has been established, the greater the radius of its impact and on the communities in which they serve. I'm going to shift to a different project. This one is called the Web App. So recently, last year, Church Health partnered with Well.Inc. To evaluate factors associated with adoption of and engagement in a digital health platform designed to advance member health. Okay, so this is something new and innovative. This is a pairing of technology with patient care. And this has been heightened, especially since everything that we've gone through in the past 2 years with COVID. COVID and people having access to the care that they need in all aspects of life, whether it be nutrition, whether it be behavioral health, whether it be primary care, and needing to just talk to someone and engage with someone. But this app provided the opportunity for this. So the Well app uses an unprecedented combination of personalized guidance, motivation. We also have a reward-based system and support from guides to engage members and our patients in the advancement of their health. So, of course, I mentioned everything that we do, we have to measure, okay? So overall, we wanted to measure overall health status, nutrition, making sure they were adhering to their medication schedule as well. To be eligible, they had to be a patient within our system within the past couple of years. This was specifically targeted and focused on our pre-diabetic or pre-hypertensive patients. They had to have a diagnosis of type 2 diabetes, hypertension, ischemic heart disease, chronic kidney disease, and also taking certain medications for those diseases. As a result, they are able to get rewarded for some of their input and engagement. This bottom chart shows you a breakdown of the demographics of the population that was activated. So we had about 517 patients. Next slide, please. We had about 517 patients that were activated on the Well app. This was primarily 75% female, and the majority, we were surprised, the majority of our patient population was of the age group between the ages of 50 and 59. So prior to implementing this study, we did a short pilot with some of our population when it came to the usage of technology and their cell phones. And we didn't know if all of our patients had access to smartphones or devices and things of that nature. And we found out that they did. And they were able to actually use their cell phones or their smart devices. So once we found that our patients had access, we were then able to implement the usage of the app. And it was interesting to note that within our patient population, that age group was more engaged with app usage. And so they were able to, we also had our Spanish speaking population engaged, close to 20% of our Spanish population, and then 80% of those activated also was our English speaking population. And so they were able to do different activities, actions completed per month. Next slide, please. Okay. And this is just a snapshot of some of the actions that they engaged in to improve lifestyle habits. So when it came to mental wellness, smoking cessation, reduction of alcohol use, engagement in exercise, and improvement in diet. They also were encouraged when it came to things like getting their annual preventative visits, getting their flu shots, and things of that nature. They also had personalized well guides in which they were able to chat with for well health and wellness support. If they needed access to resources or things of that nature, they were able to engage on those topics as well. Next slide. The biggest thing is that we were counting on, which is actually showed when it comes to our number of patients who were able to complete cardiovascular risk reduction actions. And as you can see over time, a lot of those actions had to do with nutrition and diet as well, which was big, and also exercise as well. Next slide. So then we're able to use some of our EHR data to observe these changes in our patients over time when it came to their numbers, when it came to their blood pressure, when it came to their glucose levels, when it came to their A1C levels and things of that nature. So those who had activated with elevated blood pressure, we were able to keep track of them. And then we noticed where that started to stabilize over time as reported. And then we're able to see a decrease when it comes to their systolic and diastolic readings. Next slide. Also, when it came to diabetes management, those who had their A1C levels, we're now able to get their average A1C levels to at 7 or low 7.5 in that range that we wanted them to be as well. Next. And then a big one that we've been focusing on is the social determinants of health. And I know many of you are familiar with when it comes to the social determinants of health. These are all of the external factors that some might not necessarily immediately think of, but that have a huge impact on the health and well-being of our population. So it could be things from your background, where you live, low level of income, not having access to food, transportation, literacy. All of those aspects affect your health. And so these social determinants of health are playing a huge role. And so we're starting to tap and dive into some of those as well. So if a member reached out within this app and said, hey, I don't have food for my family this week, or I can't make it to my doctor's appointment, then they were able to be connected with a well guide to provide access to the food bank that may have been giving out food, or if they needed transportation to their appointment, or if they needed rent and utility assistance, we're able to connect those patients to those resources. And so this is some of the feedback that was gained from the members' level of interactions for those. I'm going to move on, touch the first two. Let me go back one. This next one has to do with transit and health equity. So I mentioned earlier that we were tapping into the transit, the social determinants of health. Well, a big issue within our population that was highlighted was transportation. The transportation system in Memphis is horrible. It only has a bus system, and sometimes those bus routes take hours for a patient to get from their home to their appointment and back home. That's like a whole day, especially for those who have issues with working and taking off of work. So we decided to dive also into the transportation aspect, and we developed what we called this Transit and Health Equity Group, which was made up of representatives from Church Health, Road College, University of Memphis, and then other city institutions such as My City Rides, Innovate Memphis, Commute Options, and the Center for Transforming Communities. So this Transit and Health Equity Group was centered to provide transportation justice by providing a space to examine and discuss strategies, current trends, research, and best practices for equitable and sustainable and accessible transportation system within the city. This is still underway, but this is one of the things that we were able to accomplish. Next slide, which was the Memphis Mobility Symposium. Next slide. So within this symposium we had back in February, we were able to bring together all of the transportation entities within the city, all of the local organizations that were working in that space, to have these key conversations and discussions to then therefore go and implement some of the changes within our transportation system that was needed for our population. So this work is still ongoing, but I wanted to provide that as a snapshot and example. Next slide. I'm moving on. Is the reduction of hospital admissions and healthcare costs within a local healthcare system. Next slide. All right. So this was a partnership with two of our local hospitals. The one I'm highlighting now is with Baptist Memorial Healthcare. And this was to understand outcomes of patients who were referred to this hospital for emergency department visits or inpatient stays, ultimately to try to make a connection for access and a positive impact on for people who cannot necessarily afford that healthcare. So it was basically setting up a population comparison study to match these patients to other uninsured patients who may frequent that particular hospital. So this study had three main aims. Next slide, please. Aim one was to track the quantity of services provided by this local hospital for our clinic over time. So as a result, this hospital was trying to be more engaged to provide more services to our patients. So they were donating more services, and we wanted to establish a method of tracking utilization by our patients. Next slide. So we did this looking at fiscal year 2016 to 2021. After we implemented this, you can see this was implemented around the fall fiscal year of 2019, this uptake of patient use and medical services provided by this local hospital. There's this slight downward tick due to COVID, but that is now trending in the other direction. Next slide. So as you see also numbers wise, between fiscal year 2019 when this was implemented, we almost had more than double jump in our usage by our patients of this local hospital system as a result of this collaboration for medical services. This next slide just shows how those charges increase for those with our patients who were treated by this medical system. I'm moving quickly. Next slide. The second aim was to compare health outcomes for our patients who are managed by Baptist primary care physicians compared to those uninsured patients that don't necessarily have managed care. And so we want to demonstrate that these patients were receiving equivalent or better care. And then as a result of them having a provider, there's a reduced utilization of services at the local hospitals, meaning they're not frequenting the emergency room and things of that nature over time. Next slide. So this showed that that was necessarily the case for our patients. There was a lesser number when it came to that patient population that was frequenting the hospital. This is a breakdown of some of the demographics. Moving on, next slide. And it was statistically significant, this is for all my faculty out there, with a p-value of 0.01 as to the difference between those patients who were treated by primary care providers compared to other uninsured patients who did not have a patient-centered medical home. I'm moving quickly. Next aim was to compare outcomes for church health patients that may have been seen in the ED or admitted at inpatient patients within the hospital. So we wanted to follow up to show that they have better health outcomes than other uninsured patients in regards to their length of stay. So they're going to have a shorter length of stay. They're going to have a shorter number of readmissions, and their cost of healthcare services would be reduced in addition to their ED visits. Next slide. So to summarize, these patients had statistically significant lower 14-day ER revisits compared to other uninsured patients. They did have a higher readmission rate, but it was not statistically significant. And then they had a lower risk-adjusted mortality, which means that our patients weren't dying than other Baptist uninsured patients. I'm moving on quickly. I'm watching my time. Next, I want to highlight the ER hospitalization utilization case study. So I showed you this project that we did with one of the local hospitals here in this region. But of course, with everything that we do, we want to be able to scale up those efforts and be able to do that on a national scale. So we partnered with the National Association of Free and Charitable Clinics, in which to provide tools in which other clinics that might be interested in conducting this same type of research and analysis to have access to and to illustrate what kind of results may be expected in addition to reduced utilization and lower costs, and show this on a national level. So we put together, next slide, what we call workbooks. This is an example of one in which you use this metric as an estimate of your clinic's impact. So it's designed for clinics all over that want to use this estimate. There's about 7 workbooks on different topics that are able to then apply this methodology within their local region as well. And it walks them through step by step to be able to do this in this research. Next slide. This is an example of and we put it in terms in which they could understand. Okay, so not too high level, but terms that they can understand and that the layperson can then implement. So this study we acknowledge to as if you were making a local sandwich. Okay, and so you have your data, which is your bread, and that can be things like your EHR, your data reports, emissions, and things of that nature. Then you choose your metric, like your vegetables that you want to put on your sandwich, what that looks like, your lettuce and tomato. When it comes to your visits or your number of patients, then you can choose your veggie meat if you want wham or if you want turkey or if you want cutlets. You choose your meat that you want to compare. You always have a pre and a post when doing your comparison metrics. And then your last piece of bread. And then you have your sandwich that is put together when it comes to using your case study, and you're able to show your outcomes and examples of what your sandwich may look like. So that's just an example of that. I'm moving on. Next slide. Another one that I want to highlight is this Diabetes Wellness and Prevention Coalition. And this is something that is formed locally by several organizations within the city: University of Tennessee Health Science Center, the hospitals, Methodist Regional 1, Christ Community, Memphis Health Center. So this is a region-wide patient provider and research partnership research network that serves over 900,000 people within this area to improve diabetes care. And so what you see here on this is an example of a report. It shows the diabetes patients demographics for each area within the population. And then it gives you a breakdown of certain measures that you're looking at. So on this next slide, it'll show the percent of your patients which may have A1C tests that are above a certain level. and how your organization or how your clinic is performing compared to the rest of the community. And the next one that I wanted to highlight is within our specific population, over 91% of our patients were able to have their test. And then we were able to get our patient population to about over 70% of our patient population. Next slide, please. Over 70% of our population has reduced their A1C level to below 7%. So within our patient population, the two things that you can see that I've mentioned that we focused on primarily, that is chronic diseases that are plaguing our population, are diabetes and hypertension. And so these two areas that we were able to focus on to improve our numbers in that regard. Next slide. Okay, so I mentioned that part of our role here is to address some of these barriers, social determinants of health, and things that are affecting our local population. This next one that I'm highlighting is the food insecurity. Next slide, please. Food insecurity and food access collaborative. And so this has to do with organizations such as the Mid-South Food Bank, MIFA, Memphis TIF, Fish and Loaves, the Tennessee Department of Justice, Farmers Market, other organizations within the city who are working as a collaborative group. And this is our mission statement. Next slide. To execute a sustainable cross-sector coordination plan to achieve the eradication of food insecurity and food accessibility in the Memphis metropolitan area. Next slide, please. Okay, you keep going. Next slide. So this kind of gives you an example of the timeline as to when this first collaborative started back in 2019, how we're able to start bringing more partners together, have voices at the table, and then developed what we call a planning committee, which implemented a food summit. And this food summit brought together, we've done it now for 2 years, brought together experts in the area addressing food insecurity, food justice, food access from all over the country, along with our local leaders in this field, to delve deep into some of the aspects that were affecting food insecurity within our region. So we did things from GIS plotting, mapping out our food deserts, looking at some of the barriers and limitations to access. And we had 2 annual food, it's an annual thing. So now we've had 2 of these annual food summits. We took it a step further, taking the information that we gained from our food summits and developed 5 focus work groups. And these focus work groups targeted and drilled down into certain areas such as workforce development, job development, transportation, access, farming and growth, and things of that nature. As a result of that, we then developed what we called a preliminary proposal. Next slide, which was entitled Fostering Food Equity in Memphis, a proposal for the Office of Food System Policy and Programs. Next slide, please. Next slide. Okay. Yeah, I don't think this is the right version. Yeah, you guys. Yeah, not the right. This isn't the right version. Can we go back to my share? Okay, thank you. Okay, I'm trying to get through these next ones pretty quickly. So within this, we were looking at 4 main areas. 1, financial resources and affordability when it comes to income and snack benefits, availability when it comes to the location of stores and other food resources, mobility, transportation, then the quality of food, and then also when it came to areas to frame the disparity and radicalization of this food insecurity. So there are various aspects when it comes to the complexity of the food system and the need for a dedicated public office to coordinate the representation and collaboration from all of these food system elements in order to achieve sustainable solutions, which are driven to drive this change. So these are the different elements in this complex system as well. So we proposed to have this permanent paid position added within city government, under the Office of Food Systems Policy. This is a salary we wanted to have and responsibilities of this role that would be included, but basically asking the city to champion and fund. It would have council members and things of that nature. So currently this has been presented to the city. And the mayor has it. He has approved it, and we are now working with city councilmen to develop this office. And there's conversation as to whether it lives at the county level or at the city level, and there's always that level of conversation back and forth. But this is currently in the works for funding and implementation. Moving on, last thing. Back up one. Part of also what we do, I told you, is to implement the things that we're doing locally to impact more abroad. And so the last thing I'm going to focus on is this last one, which has to do with curriculum development when it comes to healthy eating and nutrition. We all know that life and vitality is with nutrition. And so we developed a church health cooking curriculum. So we simplify content for the community and the layperson to be able to understand, learn, and retain the information. It's budget conscious because people don't have a lot of access to high price things to be able to afford for their family, but we give them tools in which they're able to use the things that they already have or may be familiar with to create more healthier options. So we developed this cooking curriculum. It's called Cook Well, Be Well. And with everything we do, we have to make sure that we show pre-post and the impact of it. So we make sure we do surveys, they have presentations, they have a guide that goes with them step by step. When they talk about even the things like their grocery list, equipment, recipe videos, we make sure that we do everything in English and Spanish. And then they have access to a library where they can get other components as well. Within these surveys, we make sure that we were teaching three things. One is the Mediterranean diet, cooking skills, and confidence. Some people don't even know how to chop properly or use correct knives and kitchen utensils as well. And then the third goal was to teach the model for healthy living that I mentioned earlier, which was a holistic approach to whole person health and wellness. So this is an example of some of the series in which we did, and some of the examples of menus and recipes and instructions that they could have in which they could develop healthy options. So I wanted to show this to you as to when it comes to our measurement of pre and post. As a result of this curriculum, we then saw 18% in average score when it comes to knowledge of the Mediterranean diet. Their 22% increase when it came to their cooking confidence, and then also a 16% increase when it came to their usage of the model for healthy living. And so this was major, and this has been piloted only within this first year that we're able to now see this level of increase. I'm moving quickly. I'm almost done. These are just some aspects of examples of our presentations, abstracts, manuscripts that we've done. So I had a PI that I used to work with tell me either publish or perish, right? So everything that you do, you need to make sure that it's disseminated. So this is just some examples of that. I'm clicking through these. I am almost done. And so some of our next steps that we want to make sure that we're doing is continue to find partnerships within this work, creating databases, housing the data, distributing our resources, making sure that we're making those resources available and accessible to all within our community, and then ultimately finding long-term solutions. So many times we start and stop things, but we don't make it sustainable over an extended period of time to further benefit our community. And then future collaborative planning as well. We develop a research forum. We're also developing a community center for research and engagement, and also a public health center that partners with our university and also with the Shelby County Health Department. So that's ongoing and part of our vision and planning as well. I wanted to share this with you. This is our Healthy Memphis Initiative website. Feel free to go and check it out at your leisure, and it'll give you more information about all of the work that we're doing here as well. And I am done. I think I made it through in time. My timer I have 6 seconds. So thank you all so much for your time and attention, and appreciate this opportunity.
Okay, thank you, Dr. Ruggles, for sharing this critical research from the University of Memphis. You talked about shared goals and vision, and these goals and vision address healthcare needs of the underserved population and how church health is making an impact on health of these minority population. You also talk about the shared goal as to reclaim the church's biblical commitment to care for our bodies and spirit, to improve health and well-being so that people can experience the full richness of life. You also talked about how we can have strong partnerships and commitment within our communities that will improve experiences in care, life, health, and well-being of the population by pursuing new knowledge through integrated collaborative research along with interdisciplinary studies and discoveries beyond our walls. As we marinate on Dr. Rugglas's presentation, we get a true sense of how important the research of our presenters today are, and what Dr. Rugglas described as bringing new knowledge through integrated collaborative research. As noted by Dr. Rugglas, the community impact of this work will, number one, achieve health equity and make improvements in the outreach and management of community resources. It would also, number two, target collaborative research programming that addresses healthcare disparities and communicable diseases within our communities. It'll also help to reduce chronic diseases and the impact of social determinants on health. Thank you, Dr. Rugglas, for this call to action for us to find ways to engage people of faith in our mission to offer whole person care and reduce health disparities in our community. And in doing so, this can be done through collaboration efforts between various researchers and other institutions through a continuous flow of knowledge and expertise to this work. Thank you again, Dr. Rugglas, for bringing this very important and critical topic to our attention.
Hello, everyone. That was an amazing keynote presentation by Dr. Rugglas. I am here to actually present our next speakers. I'm here to speak on Dr. Marcia Burden and Professor Savona Greer. Dr. Burden is a native of Atlanta, Georgia. She is a graduate of Oakwood University with a BA in political science and a minor in mathematics. Upon graduating from Oakwood, she attended Valparaiso University School of Law, where she earned her Juris Doctor and her LLM in taxation from Villanova University School of Law. She worked in legal aid and corporate law before transitioning into her current role as pre-law program director, honors program director, assistant professor at Oakwood University. Dr. Burden has conducted research in the area of science, government, and law. She is a certified professional legal researcher by LexisNexis. Her work has been published in both legal and educational journals and magazines across the United States. Professor Savona Greer is originally from sunny California, but recently transplanted to Huntsville, Alabama. She's a graduate of Walla Walla University with a BA in history and minor in Spanish. Upon graduating from Walla Walla, she attended California State University, Fresno Community College, Fresno, where she earned her master's in history. She taught at the secondary and community college level before transitioning into her current role as assistant professor of history and an international relations program coordinator at Oakwood University. She is also in the process of earning her PhD in history from the University of Alabama. Ms. Greer specializes in American history, specifically the subtopics of immigration, identity, race, and ethnicity. Her work has been shared at numerous conferences as well as publication in the Encyclopedia of Seventh-day Adventists. So we will now welcome Dr. Burden and Professor Greer to present their research.
All right, good morning, everyone. My name is Dr. Marcia Burden, and I'm excited to be with you today to present on our research for today. And so I'm going to pull up our slide. And so today, along with my co-investigator, Professor Savannah Greer, we will be talking about the topic of social networks and their impact on protest movements. So as we're introduced to this topic, in the wake currently in our country of social unrest, protest movements have been captured like never before. As protest movements have so much evolved, so has our coverage of protest movements, and that of real-time video footage. And how do we get this footage? None other than social media networks. Our research and our project and presentation this morning will study and look at social networks and their importance in protest movements. Our goal is to provide a blueprint for our students who, as you know, are very active on social networks. And we want to provide a blueprint so that they can use these social media networks in a way that will further protest movements, not only in the United States, but around the world. And so at first, we need to be introduced to social networks. What are social networks? Social networks are defined as tools. And these are tools that are able to reach and influence groups of citizens on various subjects and issues. Social media networks have replaced the pre-existing mobilization structures, hence becoming the new coordinating tool for almost all social movements in the world. What does social media do? Social media allows large crowds to act together with little need for what we'll look at later in our historical presentation, formal organization and a prominent leader. New social media has promoted a new type of what we consider virtual collective identity. And as we continue to research and study social media networks, we understand that these particular platforms are actually very important and very critical for both our political and social activists. New social movements today revolve around individuality and personal views. And so let's talk about some of these networks. The first network that I would like to discuss is that of Facebook. I'm sure everyone has heard of Facebook, and you're more than likely are a part of this particular social media network. But let's look at some statistics because it will tell us how important Facebook is. Currently, as of January this year, Facebook had 2.9 billion active monthly users, placing it number one of our world's most active social media platforms. The total number of people that use Facebook each month has increased by 2 million. And these figures kind of let us see that roughly 36.8% of all people on the earth use Facebook today. Let's look at our next network, and that is Twitter. Twitter has been buzzing in the news recently, especially with Elon Musk and the potential of buying all these shares. But let's look at some statistics about Twitter. Twitter is the 9th most visited website globally and the world's 7th most favorite social media platform. There are about 329 million Twitter users. 1/4 of US adults actually use Twitter. And guess what? For my men that are tuning in, 70% of all Twitter users are men. Twitter is also one of the most liberal social media platforms. And we can see that. Now, you might say, well, this is interesting. How is this related to social movements and political movements and protest movements? Well, guess what? On Twitter, one of the most popular Twitter accounts is that of our former president, Barack Obama, followed by Justin Bieber, Katy Perry, Rihanna, and Cristiano Ronaldo. So as you can see, one of the most popular Twitter users was a former president. This is clearly identical to political and social movements. Next, let's take a look at Instagram. Instagram is the 7th most visited website in the world with 2.9 billion visitors in a month. Most Instagram users actually have other social media platforms accounts. Now, this is where it becomes very important. When we're looking at our young adults and our college students, ages 18 to 34-year-olds make up the biggest share of Instagram's audience. Instagram is Gen Z's favorite social platform. 59% of US adults use Instagram daily. And guess what the most popular hashtag on Instagram is? It's love. And this past year, Instagram's advertisement reached and outpassed even that of Facebook. Now that we've looked at these social networks, we understand what they mean. We understand their definition. We've reviewed the statistics. Let's transition to what we consider a new mode of protest. As stated earlier, social media platforms, they are the literal heartbeat of recent protest movements. The activity that these billions of people use on social media platforms are at the core of what we consider fundamental transformation in activism. Social networks transform also our dynamics of this activism. And so now that we've been introduced to social media, we know now that they are very vital and critical to protest movements, to activism. We want to take you back on a historical comparison to kind of see what were we using before. Social media networks weren't always in existence. And at this time, I'd like to call on my colleague, Professor Savannah Career, to present at this time.
Hello. Throughout history, protest movements have been used to bring about change. These multifaceted efforts have historically generated varied results. The characterization of protest movements, both by print and television news media, has heavily influenced their reception and effectiveness. As forms of mass media have transformed over the decades, so has their influence on protest movements. This trajectory of influence and change is evident when looking at the Montgomery bus boycott, Selma March, Black Power movement, and the 2014 Ferguson protests. These events trace changes that occurred in media coverage from dominant print news media to dominant television news media. This increased visibility and support for the 20th century civil rights movement. It also brings to light how a shift in media framing tactics eventually decreased support for the movement. But just as the growth of television news media changed the impact of protest movements in the 1960s, so too now is the birth of social media networks transforming the landscape for protest movements and creating seemingly boundless possibilities. This historical analysis seeks to track the trajectory of news media's impact on civil rights era protest movements to create a foundation for better understanding social media's potential impact. Traditional print and television media impact protest movements through framing. These media outlets choose a theme and build a narrative with supporting facts and figures. This theme is the frame, which then determines what information is selected, excluded, and what is emphasized and elaborated on. The frame determines the vocabulary used to label participants, as well as the visuals used to evoke emotion and other important details. The media's organization of these frames makes the event being covered easy for the public to digest. They help audiences define the issue at hand, identify the cause of that issue, judge the participants, and propose remedies for the suggested issue. This easy to digest frame places the media in a position to construct cultural reality rather than be an objective reflection of that reality. News media frames have been used to both promote and hinder protest movements. The full spectrum of experiences is evident in the events I will cover. The first event is the Montgomery bus boycott of 1955. This boycott took place when printed news media ruled the day. The coverage of this event was, it was one of the first grassroots mass protest movements of the 20th century civil rights movement, and it is an early example of media framing's role in the civil rights movement before the development of mainstream television news media. Now, Montgomery, Alabama is considered to be the birthplace of the Confederacy. During the 1950s and prior, it was a firm enforcer of Jim Crow laws, which mandated segregation. One of the most aggravating Jim Crow laws in Montgomery was the city bus segregation. 63% of Black women in the city and 43% of Black men in the city relied on this public transportation. And for many of these citizens, this meant daily facing humiliating Jim Crow laws and affronts to their humanity. In 1954, segregation was ruled by the Supreme Court to be unconstitutional, yet the city continued in its ways. Although there were political activists like the Women's Political Council, led by Joanne Robinson and others, who felt concerned with the continued segregation. Within the year of 1955, these segregation laws were challenged several times by several women. Two of them were teens, and one was the 42-year-old Rosa Parks. This string of incidents opened the door for the Women's Political Council and E.D. Nixon to set their boycott plans in motion. A boycott of the city buses. This is something that they'd been discussing for years, but had never had the open door to actually bring it to fruition. The WPC created flyers to communicate the boycott to the Black community, and E.D. Nixon connected with journalist Joe Asbell of the local Advertiser newspaper. Nixon shared the boycott plans with Asbell and gave him several of the WPC flyers, and the story actually made front page news that Sunday. The protest was a success. There was a great degree of organization and participation. It was originally scheduled for one day, and then it ended up lasting 381 days. And this resulted in the 1956 Supreme Court decision, Browder versus Gale, which declared bus segregation laws to be unconstitutional. A key to the mobilization and success of the Montgomery bus boycott was the media framing of Rosa Parks' arrest. As previously mentioned, several other women were arrested for civil disobedience prior to Parks. What made the difference was Parks' kind demeanor and persona. The image of a decent, hardworking, church-going lady treated so poorly sparked the sympathies of both Black and white Americans. The incident made national print news. It opened the eyes of people around the country to the blatant discrimination African Americans faced in the South. The story's narrative hit an emotional chord with many Americans. Even though the boycott required the participation of many African Americans, Parks' image simply took center stage in the media and drove broad support for the protest. Bringing regional injustice to the national stage became a hallmark and potent strategy for civil rights leaders in the future. Now, over the next 10 years, there was a big change in news media, and that came through the advances in television. The first television station was authorized in 1941. Its growth was slow. During the 1950s, the ratio of radios to televisions was still 9-1 in American homes. But television did greatly impact its viewers, from increasing the popularity of bowling to making Mr. Potato Head an overnight success. Television became a producer of mass culture in the United States. By 1960, television sets could be found in 87% of US homes, and they became a centralized national medium. Airtime became gold. Television no longer simply proffered sports and children's toys, it also defined social norms and spread political ideas. This evolution included the rise of television news media. In 1948, the television station CBS began airing a 15-minute daily news segment. Now, I know that's hard for us to imagine because we're used to constant 24-hour newsreels, but back then we had 15-minute segments daily. But with changes and the staggering growth of television, in 1963, CBS launched the first ever 30-minute news series. This greatly impacted the field of journalism in general and also its relationship with protest movements. With this mainstreaming of television and expansion of television news media, civil rights leaders were able to deepen the movement's impact. By bringing the sights and sounds of local discrimination into living rooms across the nation. And protests such as the 1965 Selma March received more airtime than previous episodes of the civil rights movement and garnered crucial support for groundbreaking civil rights legislation. After months of working towards voting rights in Selma, Alabama, the Student Nonviolent Coordinating Committee and the Southern Christian Leadership Council were inspired to stage a protest march from Selma, Alabama to Montgomery, Alabama, which is a 54-mile walk. The marchers were calling for the right to vote and protection for African American voters. On March 7, hundreds of marchers who were led by John Lewis and Hosea Williams embarked on their journey from Selma to Montgomery. The protest began smoothly, but as soon as the group crossed Edmund Pettus Bridge, they faced a blockade of state troopers. The troopers' leader, John Cloud, encouraged the protesters to go home, and when they stood their ground, the troopers moved forward and brutally attacked them with tear gas and billy clubs. Despite the violence inflicted on protesters, they maintained their commitment to nonviolence. This day, forever onwards, has been known as Bloody Sunday. By the evening, the footage of this assault made national news, and King made a call for support in the fight against racial injustice. There were 2 other attempts at this march, and on the third attempt, rather than having hundreds of protesters, there were thousands. And upon arrival in Montgomery, there were 25,000 people in a celebratory crowd. And this led to the 1965 Voting Rights Act. Visuals have a substantial impact on society. In relations to individuals, events, and issues. The television footage of Bloody Sunday provoked the national conscience, and through images of white attack on nonviolent African-American protesters, the news media exposed the contradiction between liberty and white supremacy. According to David Halberson, television was the instrument that had the greatest impact on the civil rights movement, and it exposed racism to withering new scrutiny. Journalists had a new role. They were in the midst of the protests, and they were showing it from that camera angle. Studies show that subordinate group activists can influence national agendas and construct frames if they use tactics which do not disconcert elites. The Student Nonviolent Coordinating Committee and SCLC, their protests followed nonviolent ideology. This was viewed as moderate. It correlated with the beliefs of journalists and media managers, and this led to a positive framing of the protesters. And the vilification of antagonistic characters such as Selma's Sheriff Jim Clark. The civil rights movement was inevitable, but even John Lewis has acknowledged television's crucial amplification of its message. The news media created America's historical memory of these events. Up until 1966, the new power of news media had been wielded to benefit the civil rights movement. Unfortunately, the media frames began to shift. Television news has often been driven by events and not issues. As noted earlier, the 1960s media was motivated to cover civil rights protests because of the drama unfolding and its interest to viewers. In line with increasing television news coverage of social and political upheaval, the Watts uprisings of 1965 drew considerate media attention, but the camera lens had shifted. The image of African Americans was sharply transformed, where in the spring of 1965, the dominant symbol was a petitioning Black voter being brutalized by troopers in Selma, Alabama. By the fall, this had been countered, if not displaced, by visuals of disorder in Watts. There was a new prism that was being used. This incendiary coverage was used to increasingly fuel white backlash. And when the Black Power movement was birthed, it was also characterized with a negative media frame, something called the protest paradigm, where protesters are viewed as a threat to order. Now, this is where social media comes into play. Social media gives the opportunity to change the protest paradigm. We can see in a study on the Ferguson protests in 2014 that the traditional protest paradigm was used by media outlets. A study of #Ferguson on Twitter showed that the general public focused more on race and racism in this event, while news media outlets focused mostly on the actual protests and violence. Understanding the power of social media in today's world is important. It allows us to redefine the way protest movements communicate, both internally and externally. Thus, in order to understand protest movements today, it is necessary to frame them in the wider picture of how the relationship between media and society has changed during the digital age. Every aspect of the way in which protest movements act today can be regarded as an opportunity offered by the news media scene where protests take place. And we have at our fingertips a more interactive, social constructivist, and bottom-up model of framing where everyday citizens, rather than traditional hierarchical media organizations, produce content. This provides hope for protest movements. Thank you.
Yes, thank you so much to my co-investigator. And so as we continue on, we now want to look at social media networks and particularly how they allow students to be involved. Because now with social media, students can be involved simply on their own terms. And so first we want to look at the category of an anonymous leader. Unlike what we just heard from my co-investigator, Professor Greer, where you had prominent leaders like Dr. Martin Luther King and Rosa Parks and John Lewis and others, today, a lot of our leading actors in social media that are over protest movements are actually anonymous. And that is because they do not necessarily want to be known or recognized publicly as leaders. So what social media networks do is they allow people to be participatory instead of what we consider recruiting followers. Thus, active user engagement enabled by social media doesn't make leadership in protest movements obsolete, but rather it incorporates social network user contributions as a new mode of leadership. And that is what our contemporary protesters are seeking. They are seeking to transcend traditional political alignment, not be known publicly, but to make a difference in the background. Young Americans are definitely on social media. and in particularly, they're involved in protest movements. According to Pew Research study, younger Americans tend to have a more positive outlook on the use of social media in social movements. The study further shows us that about 2/3 of Americans say this statement: social media highlights important issues that might not get a look and a lot of attention otherwise. And then social media also helps give a voice to the underrepresented groups. And 64% describe social media as very or somewhat well informative and an outlet that they can well use. Another positive about social media is that of what we consider acceleration. Social media actually allows users to move and exchange information in instant time, and particularly instantaneous, okay? And with acceleration, when we have this information flowing so quickly and so powerful at the same time, that is going to equal empowerment. The rapid spread of this information helps to validate and expand even more information, as well as kind of override the social media bias, which we know exists and travels along with social networks. Today, almost everyone gets their news from Twitter. Twitter is so powerful. They check it every day and they're using this as a resource. And so social media allows an activist, and that's what we want our students to be. We want them to be activists. It allows them as activists the opportunity to capture protest events as they unfold, and at the same time share their feelings about what's taking place. I also want to talk about the importance very quickly of hashtags. So the tactic of hashtag is not simply used on social media networks alone, but also has been taken to the streets. When we look at research on transnational social media communication, it shows us how prominent and popular users such as activists, bloggers, and journalists actually use these hashtags across several different accounts to what we consider garner attention to their respective causes. Some examples that my co-investigator talked about are that of hashtag #MeToo, hashtag BLM, Black Lives Matters, hashtag woke, and there are a laundry list of hashtags, and these are very powerful tools that social media networks afford activists to spread their cause. As we conclude, social media networks are truly important and they have a huge impact on protest movements. The opportunity for the study of modern communication technologies and their impact was afforded by social media. Today, social media networks have played a vital role in recent protests around the world. And I love how Oxier and McLean state this. They say, the greater the intersection of the demands of social movements and their harmony with the collective identity, the greater the number of members of society likely to participate in the protests and campaigns to achieve these demands. I encourage all of our students and all of us to become active users of social media. Let us use them as a tool to impact the world and to spread the love of Christ.
Thank you so much. That was actually very, very inspiring to hear this, because right now we are living in a society that is dominated by social media. So I just have a question. The question is, how can university professors like myself or across the nation, or maybe influencers that you may find on YouTube or Twitter or Instagram or whatever, how can they use their platform? How can we as professors use our platform in the classroom to actually make change in society? How can we make a big impact with what you found? I would really love to hear this answer because I would like to incorporate that into my classes.
Thank you, Dr. Vanderpool, for that wonderful question. And it's very important. Here is the good news about social media networks. It uses what we call technology, right? And technology can be used in our classroom spaces. So as professors, some of us are afforded to have smart boards, or you might be able to live stream your courses. I would encourage professors, while you're doing this, to interact and engage with your students via social media. Have your students in your classroom while they're there talking about a topic, create a hashtag. And now we have TikTok, which we didn't even get to talk about. Do a quick TikTok video, have that hashtag, post it live while you're in class, and you'll be surprised how that simple hashtag, that simple video, that simple live discussion conversation will take off and transform so many lives and become the new buzzing thing. So all it really takes is for you and your classrooms to take a moment, tell your students to get out their cellular devices, make sure that you're active, engaged. It doesn't have to be anything formal. Have that discussion on a live feed and broadcast it to the world. These are just some simple tools that you can use in your classroom to ensure that what you're saying and doing is reaching millions in a matter of seconds. So use that phone to your advantage, use those smart boards to your advantage, and come up with those hashtags. It could be simple, it could be quick.
Good morning and welcome to the School of Business and the Oakwood University Research Symposium. I am privileged this morning to introduce Dr. Havlu Ramella. He serves currently as the director for the MBA program in the School of Business and also professor of accounting, management, and economics. Dr. Ramella has served in the School of Business for 3 years. He has provided outstanding leadership, and he's a very dynamic person, well-educated, multiple degrees, as you will read in his bio, and he brings a lot of extensive experience to academia from Trinidad University there, Southern Caribbean University, as a chair, dean, and professor. So we are privileged this morning to hear him present his research. His topic, a critical evaluation of working capital, management strategies, and profitability of public listed conglomerates in Trinidad and Tobago. At this time, we welcome Dr. Ramella, School of Business, Professor, Director of the MBA Program Leadership.
To present this topic on the critical evaluation of working capital strategies and profitability of public limited companies in Trinidad and Tobago. Just give me a minute. I just want to share the screen with you. Yes. As I pointed out, a critical evaluation of working capital management strategies and profitability of public limited companies in Trinidad and Tobago. In this study, we're going to see the background of the study, the theoretical framework and review of literature, research methodology, findings and analysis, conclusion, and thereafter the questions if you have after my presentation. Now, if you see, without profitability, businesses will find it very difficult, if not impossible, to survive in the long run. Managers are therefore continuously adapting strategies to improve profitability. The existing literature reveals that effective and efficient management of an entity's working capital components was imperative, not only for the sake of maintaining adequate liquidity position, but also because of the significant implication that this has for the organization's profitability, company evaluation, and shareholders' value. So the well-implemented working capital management strategies enhance profitability through various transmission mechanisms. In this context, the study of the association between what you call the association of the working capital management and what you call the profitability is very, very important. So in this study, therefore, sought to examine two research questions. The first are individual working capital components significantly relate to profitability among selected public limited companies in Trinidad and Tobago. The second are working capital management strategies, aggressive or conservative, significantly related to profitability among selected public limited companies in Trinidad and Tobago. Now, to answer these questions, the following specific research objectives were therefore addressed. The first objective of this study is to analyze the individual working capital components of public listed conglomerates in Trinidad and Tobago over the period 2016 to 2020 using appropriate statistical tools and ratios. The second objective of this study is to determine the type of working capital policy strategies adopted by these conglomerates using appropriate statistical tools and ratios. And the third objective of this study is to analyze the profitability of public limited conglomerates in Trinidad and Tobago using appropriate statistical tools and ratios. The fourth objective of this study is to analyze the relationship between individual working capital components and working capital management strategies. And if you see the further, the researcher has used the following empirical conjectures or hypotheses. The first empirical conjecture is that there exists a significant correlation between working capital components and profitability. And the second empirical conjecture or hypothesis is that there exists a significant correlation between working capital management strategy and profitability. Okay, when we see the theoretical framework, first of all, we should understand the concepts and the terms that are used in the study. The first concept we should understand is gross working capital. What do you mean by gross working capital? The gross working capital consists of all the current assets, the total current assets that are maintained by the organization, okay, such as cash, account receivables, inventories, and also it includes accounts payable and also accrued liabilities. When we're talking about net working capital, it is the sum total of all current assets minus current liabilities. Okay, and if you see operational working capital is actually, it removes the financial items. It only concentrates on non-financial items which are related to, which are process related items such as inventories, account receivables, and payables. So therefore, theoretically, it is in the studies, research showed that the net working capital should have a negative relationship with profitability. Now, let me explain why this. Because when the working capital, that means every organization, in order to survive, in order to meet its short-term obligations, it has to be at least maintain 30% of its total assets in managing the company or short-term obligation or meeting short-term obligations. So as a result, what happened? You have to have a balance. That means the more you keep cash balance, that means, okay, the less will be the profits. So that's the reason the less is the cash balance or current assets minimized, the more will be the profitability. So therefore, always there is a negative relationship between what you call working capital. Less will be the working capital maintained, higher will be the profitability, and higher will be the working capital maintained, okay, less will be the profitability. Now, we should also understand what are the strategic policies or policy strategies related to working capital. There are three different types of strategies can the management or the managers can use in an organization. One of them is aggressive strategy, okay, working capital strategy. What it means is that you try to minimize your current assets over your total assets. Okay, in that way, what happens is that you're not locking up your money in inventories or extending what you call collection period to the customers. And also, the other way is that is called investing policy. There is also what you call financing policy when we are talking about aggressive working capital strategies. That is, you have to increase what you call current liabilities or okay total liabilities. Okay, so that way, okay, we call it as aggressive, okay, working capital policy. The other one is conservative, which is converse of aggressive, where you try to maintain what you call more what you call assets, current assets or current total assets, and also less current liabilities or okay total current liabilities, just a converse of aggressive. And there is what you call moderate working capital strategy. Now, this follows a middle path or middle road policy, which is actually it is not it is like a balance, not to have too much okay what you call working capital as well as less working capital. It is a balanced working capital should be maintained by the organization. Okay, when we are talking about working capital management, first of all, we should understand what are the components, okay, that consist of working capital management. One of them that we have to deal with is cash conversion cycle. Now, cash conversion cycle talks about it starts with the cash outlay, okay, the money that you spend or the funds that you spend in acquiring the raw materials and then converting to finished goods and then okay actually selling those finished goods. So it talks about the outlay and also it talks about the inflow or the receipts. So the time taken, okay, how many days it takes for the whole cycle, that means from the acquiring of the raw materials until okay the sale of the goods and services and converting into what you call cash. And then also when we are talking about, it is very, very important, the working capital management also takes into account the profitability. Now, every organization, they look, the main objective is to make profits. So this is very, very important. As a result, what happens is that when your cash conversion cycle is longer, that means you're actually locking up all your funds, because you know that many organizations, they try to acquire funds, okay, either through their own, okay, investing their own funds through capital, shares, or through borrowed funds. Now, if it is through borrowed funds, what happens is that the cost of financing will be high when you locked up. So that's the reason in working capital management, we try to minimize the days of what you call conversion, cash conversion cycle, so that you will be able to pay less interest because on financing, okay, because you have to finance and acquire those funds. In that way, you can maximize what you call profitability of the organization. And also, working capital strategies, as I have earlier pointed out, it actually deals with how you can employ various types of strategies in order to improve the sustainability of the organization, in turn increase the profitability. Now, if you see, when it comes the theoretical framework and literature, there are a number of studies that are conducted based on this topic, on this subject. Earlier, it was conducted, Jose and et al. Has conducted in 1996 a similar study. They have considered what you call the components, okay, few components of working capital, like for example, inventory period, payment period, accounting average collection period, and they compare these components with the profitability. And also we have seen a similar study carried out by Deloof in 2003. He has considered actually 1009 largely what you call companies, and analyzed its what you call working capital components, such as similar to inventory, payment period, then average collection period, and also they considered what you call average payment period. And it is concluded that there is a negative correlation between the individual components of working capital and profitability. And similarly, the studies were carried out by Lazar Diaz and Trifon Diaz in 2006, where they considered 134 companies listed in Athens Stock Exchange. And what they have done is they concentrated on the liquidity ratio. That means basically they have considered the what you call individual working capital components, such as the again the collection period, and also they considered what you call average payment period. And lastly, there is also a study carried out by Rahman and Nazir. They have selected 94 large-scale companies, Pakistani-based companies listed in stock exchange. And here, their studies are a little different. They concentrate on the current ratio. Okay, the current ratio is the ratio between the total current assets or total current liabilities. And they also have found that there is a strong negative correlation between the working capital components and as well as profitability. Now, how this study is little different from when you compare these studies. If you see in this study, which is carried out, the researcher not only what you call considered various components of working capital, but also he has considered various working capital strategies, which in that way provides a comprehensive, inclusive, and logical what you call findings, so that we can draw logical conclusions. So therefore, this study is little different from the studies that are carried out. And one more thing is that this study, so far, there are no studies that are found in Trinidad and Tobago. This is the first of its kind that is carried out in Trinidad and Tobago. And when you see the research methodology, we use what you call positivist approach in this meaning that it is only based on logical conclusions drawn, okay, based on, this is the approach they use for scientific methods or based on statistics. So the approach doesn't go out of the scope of the figures, facts and figures, or within the data that is given. So it provides a what you call unbiased, or what you call not subjective, or what you call inconclusive findings, because the data is very authentic. It's a factual data that is presented or included in the research. So, so therefore, we have used this approach in this study. So the data collected. So the data was collected from a population of public limited companies that are listed in Trinidad and Tobago Stock Exchange, and non-random purposive sample from the above mentioned what you call non-financial category is used. There are three conglomerates in this category, namely Massey Holdings, which consists of around 70 companies. It's a group of companies. Ansa McCall Group, which consists of 75 companies under this, and it extends over 8 territories, including companies in Trinidad and Tobago and other parts of Caribbean region. It also have companies in US, Canada, and UK. And it has what you call 8 segments, and it has what you call employee consists of 10,000 employees serving in this organization. And there is one more what you call company, Grace Kennedy Limited. So therefore, based on these three, Okay, these are the three companies that are considered for the study, but due to lack of what you call the proper, due to time constraints and due to what you call the data that is available based on. So there are, for this study, we have considered two conglomerates for the study. The data from the audited reports of 2016 to 20 was obtained for this study. Okay, this is the what you call the framework for data analysis. So first, the study has considered in calculating the what you call gauges. First one, we have to, these are the components of working capital: account receivables, collection period, inventory turnover period, account payable payment period, cash conversion cycle, and working capital ratio. So the framework for data analysis, to analyze, we have considered the bivariant descriptive and inferential statistical analysis. We also considered contingency tables to analyze the data that is collected, graphical analysis, representation of the data where we can draw logical conclusions, descriptive analysis, bivariant correlation analysis via Pearson product movement correlation coefficient, or we call it as Pearson R-test, and also index number analysis used to analyze the findings. Now, because due to limitation time, I may not be able to analyze each of, give the results of each of this component, but however, I will just take one and set the trend. For example, if you see inventory turnover, okay, and these are the two conglomerates I have used. One is Massey Holdings, the other one is Ansi McCall. Now, if you see, okay, the collection period and inventory turnover, okay, it almost takes around 69 days, whereas for Massey, and for AMG, it takes 119 days. And same way, you see the trend continues 66 days, then 69 days, 63, and 70. But whereas you can see AMG, 109 days, then 125 days, and 104. What it reveals is that in terms of inventory, acquiring the inventory and what you call selling those inventories, the number of days it takes larger, okay, in relation to longer in relation to AMG. And that means what? Most of the funds were locked up in the inventory. And that is very, very, it reduces what you call profitability because you have to pay more money to that. But on the other hand, if you see Massey, their what you call the inventory lockup period is less. As a result, whatever they have acquired, they are able to sold it. In that way, they are able to get back the funds. In that way, it improves the profitability. Likewise, you can see each of individual components. Even if you see account receivables, if you see examine the data, Mercy has what you call shorter days of collection period, but whereas AMG has longer collection period. What that indicates is that shorter will be the period. That means you are able to acquire the what you call the funds because you would have sold on credit, but there you are able to get back the money within short period of time, able to collect from the customer. So that way, what happened? Your money was actually you are able to convert by selling your products and readily available. So where you can invest in your business and increase your profitability. So shorter will be the period of your collection period. More will be your profitability. On the other hand, same way, cash conversion ratio also it should be shorter period so that here you can see observe the trend. You can see HMG Massey company, though there is what you call a shorter period cash conversion ratio, what you call period is taking place, and this trend keep on continuing. In that way, Mercy company is doing very well in converting what you call, it is acquiring its raw materials and it is converting into what you call, it is making sales, and what you call the time taken in order to convert the raw materials and get back the money is shorter. And also, interestingly, you see the working capital ratios here. Okay, is if you observe, the less is the working capital ratio, the higher will be the profitability, and that's what we call it as it establishes the negative. The negative of working capital. That means lesser will be the working capital requirement, more will be the profitability, and you can see this trend. Okay, seen both the companies. There is a negative trend that is going on through this observation, through these findings. Same way, to see more validity of the data, we also used indexes that gives you whether it is consistent with the findings that we use through the ratios. Here also, similar trend is going on. You can see in terms of ITP, 96, you see 100, then the 93 days, then 1 or 2. That means by this trend, we know that there is inconsistency. Now, this will be bound to happen because based on, okay, when you see the mean and standard deviation, you will come to know why there is inconsistency. But overall, when you examine individual, okay, components, there is inconsistency. But if you consider it discrete, what you call aggregate analysis, it provides that we can logically draw conclusion that there is a relationship between negatively, okay, what you call working capital ratio, along with what you call has a relationship with what you call profitability. And similarly, we can also, through the graph representation findings here, we can see there is a relationship between the profitability. If you see the legends here, the dotted line is the profitability. Now you see the profitability, what happens is that when the account, what you call collection period and payment, collection period and inventory is more, the profitability is less. You see, this is the amount is less. That means it is opposite. And here you can see when it is the collection period and the inventory is less, the profit is more. You see, it is going on more. So even here in this diagram, we can conclude that the findings clearly shows there is what you call a strong, okay, what you call negative correlation, coefficient relationship of what you call working capital with profitability. And this can be further validated through what you call mean and standard deviation. I know that my time is, I'm running out of my time, but however, if you have any questions, you can ask. It also reveals there is inconsistency, but overall, I want to just show you and to summarize my presentation. If you see here, working capital ratio, which actually measures the what you call the strategies, working capital strategy. It's a proxy of working capital strategies. We can see that there is a strong, okay, I want you to observe this one, the combination or what you call the, yeah, this, you can see here, there is a strong negative correlation coefficient, 9.909. That means it has very strong negative, okay, working capital ratio when it compared to profitability. That sums up, okay, that there is a strong, okay, what you call correlation, negative correlation coefficient. In conclusion, the well-implemented working capital management strategies enhance profitability through transmission mechanism. This study analyzes the association between working capital strategies, profitability in selected public companies in Trinidad and Tobago in these theoretical grounds. Applying statistical and non-statistical approaches, we perform aggregate and disaggregate analysis of working capital strategies. There is a strong negative correlation between the working capital strategy measured by working capital ratio, which we have seen presented by the data, seen in the data, and profitability measured as profit for the year. So the working capital ratio becomes higher or more conservative, profitability decline, and vice versa. Given these results, we can then accept the alternative hypothesis that state that there is a significant relationship between two variables. The first research question, are working capital management strategies related to profitability among selected public limited companies in Trinidad and Tobago, also has been answered in affirmative. Mixed correlation results have also been observed between the separate working capital components and profitability. The results of the disaggregate analysis revealed mixed, and one case we could not find evidence of an association between working capital management strategies and profitability. However, the aggregate analysis shows a strong negative and significant correlation between working capital management and profitability. We further expand this analysis to the individual components of working capital. These results indicate a robust positive relationship between all individual working capital components and profitability, except the average receivable collection period, where interestingly there was statistically weak conclusion. And thank you for listening to the presentation. If you have any questions at this time, you can ask.
Presentation, thorough research. I have one question for you, Dr. Miller, that I would like to just ask. What you mentioned, there were a number of skill sets or a number of strategies for used to manage the working capital. Was there one that stood out that was more frequently used to generate profitability that you saw in your study? Which one of those strategies?
Thank you, Dr. Brown, for that question. In my study, I found out they used what you call aggressive, what you call working capital strategies. In the sense, they try to minimize what you call the assets, current assets or total current assets, current assets or total current assets. In that way, what they're doing is that they try to minimize what you call the lock-off period, okay, collection period. They're shortening the what you call collection period. In that way, they're able to collect the money in time. That is what we call it as aggressive. The other technique they used, or the skill set they used, is what you call, they try to what you call increase or maximize the current liability, or the what you call average payment period. Because when you increase the average payment period, that means you're not paying, okay, what you call, you're taking more time to pay, but you're taking less time to receive the money from the customer. So in that way, you're having adequate liquidity, or what you call optimal working capital. In that way, they're not using up their own funds, okay? So they don't, there is no finance cost as such, what you call interest, which actually reduces the profitability. So this is the mainly I saw they're using aggressive working capital strategy.
We want to again thank Dr. Ramella for outstanding presentation. Thank you, Dr. Ramella. At this time, we want to introduce our next presenter, Dr. Richard Blanco Toppings. Dr. Toppings is the program coordinator, associate professor, program coordinator for the Healthcare Administration program, the Bachelor of Business Administration, and the School of Business and Department of Business and Information Systems. Dr. Blanco is an experienced educator, researcher in healthcare. He has taught at Loma Linda University and Montemorelos, and he has done an extensive job in looking at healthcare as relates to patient payer services. His topic presentation is the relationship between patients' perception of care and hospital characteristics under all payer model. At this time, we welcome Dr. Richard Blanco Toppings, Associate Professor, Healthcare Administration in the School of Business.
For those kind words, and happy to have you as a leader of the school, and looking forward to continue working with you as well. And again, thank the organizers of this symposium for the opportunity to showcase the work that we're doing here at Oakwood University. We are very pleased with what's taking place, and let me begin with my work. So, should be it. Yeah. So, again, my name is Richard Blanco Topping and School of Business, and I've been working and looking at patient perception of care for the past maybe 3-4 years, and how hospitals impact hospitals' characteristics impact patients and perceptions within America, but specifically in the state of Maryland. That's where there's a different payment model there. There's a different way how providers are reimbursed and different from America, the rest of the country. And that seems very interesting for me as a researcher to look at that and see how they have improved or if they are improving over time based on the expectations. Okay, so as it says, as written there, the study aims to evaluate the mean scores of patient satisfaction rating at acute care hospitals in the state of Maryland to determine if hospitals' characteristics are associated with inpatient care experience under a global payment model. And you may ask, why am I suggesting a particular state? And it's a valid question, of course. The reason why, as I said before, because they have for many years been working under a separate payment model, under a separate reimbursement plan from the rest of the country. And since 2014, the CMS, the Centers for Medicare and Medicaid Services, has made an agreement with them to run a global payment model, which is defined as a lump sum of money given to providers in that state to operate. And the agreement would last for about 5 years. It was since 2014 to 2018, and that is over. And so far, the results are being mixed and still room for analysis. And we'll talk a little more about that as we move forward within this presentation. Yes, the Affordable Care Act has made a huge impact, a huge difference in how we assess the provision of care at these locations, at hospitals. And when the Affordable Care Act was incepted in 2010, a couple years after that, it was being released for many individuals, in the case that many people that didn't have access to health care. They didn't have the funds to pay for it as well. And when this act came out, people came out from all over the place. People were medicating themselves, staying home, and doing whatever possible to remain healthy. But once the ACA came through, it made a huge difference. And millions of individuals, more than 11 million, came across the country to be seen by doctors and providers. And with that change also came improvement. Improvement to assess how these services are really accomplishing what is expected of them. And the CMS has an Office of Improvement that constantly looking at how care is provided and modifying and working with providers across this country. And although it's the case that Maryland has its own payment model, this institute is still working with other states and local communities to also experiment with other payment models in a smaller, I would say, degree and capacity, in a micro capacity, to see if these are working or not as they receive feedback from providers across the country. So studies have shown mixed results, and it also depends on many factors or elements that are out there. It could be structural as it relates to the organization, or it could be exogenous out of the organization. It could be policies, the type of population, it could be location, so many factors that are there. It could be distance from the hospital to where the community lives. So many things can create an impact on the provision of care. Or as we're looking at today, it could be financing. Because if there isn't finance, well, there's going to be some pressure on those that provide the service, is doctors, nurses, to accomplish their work without the resources that are needed, or with all the technology that they should have at hand, right? So that's for that reason it's very important to continue researching, analyzing the data, and giving feedback to policymakers, healthcare administration, and other individuals who are interested in healthcare to understand what these changes are doing, their impact within the healthcare industry as well. Another part, say, in a previous study I look at, and in Germany, where they look at different elements, says that they use region, profit orientation, size, staffing per bed, and quality as scores as well. And they found that all of them were significant. Of course, this study they had like over 300,000 patients data with them. So that was a huge study. And by having a huge study, maybe a little more complicated, but it gives you more exact results, more results that you can analyze from. We're looking at different, depending on the survey, right? On the elements and on the variables that are integrated in that study. But they found that it was like that. So I look at it, I do my research and find out that there are few studies that look at Maryland, and especially the final year of the agreement, 2018, and these characteristics. And I said, okay, I'm gonna work in that for this symposium and do my research and then bring it to you and let you know what the results look like. And this is what I just mentioned to you. So there's literature examining, and there are mixed methods, nursing and staff, nursing and doctors, and other variables that are also looked at are the rating of patients on hospital services, and if they will recommend or not to other family members. Other thing that they look at is the transition of care from the hospital to their house or home. And while they were aware from the hospital, if the hospital contacted the patient or not. So all of this is part of what we call HCAHPS, right? So it's a hospital consumer assessment of healthcare providers and services. And they sent out every month, they sent out surveys to patients who have been in inpatient service. So let me explain. Inpatient service means that you stayed at the hospital overnight. Could be over one night or many nights. So after you have that experience at the hospital, then these organizations, third-party payers, not the hospital, but other third-party payers that are hired, sent out the surveys to patients. After maybe 2 weeks or so of being seen at the hospital, and the patient received these. You may have seen this come to you if you stay overnight, or you went to the emergency room and stay overnight there as well. They've sent a survey to you. So you have been part of that study, part of the HCAHPS study. And no worries at all, because this study, the data is de-identified, so we don't know who is who. And the data is sent to CMS, again, Center for Medicare and Medicare Services, and they do their analysis and send back the data based on patient reports. So quarterly, hospitals are required to send this data to CMS. Hospitals mean third-party payers, and it has to be between 300 or so or more cases that are sent to CMS. If they don't comply with this, then yeah, there'll be penalties, and also the report will not be displayed or shared with as public data available to everyone, right? Oh, well, I created a model. It doesn't look that good now when it comes on the screen, but let me see. Can we change? Let me see if I can fix that. Now, yeah, it's not working well there. But anyway, what I'm saying there is that there is this global budget under which everyone is operating, and in the state of Maryland. And we look at hospital characteristics. How does this affect hospital characteristics? We talk about profitability. We talk about hospitals with emergency departments. Maybe most of them in Maryland have an emergency department. And most of them also are nonprofits. A bigger group are nonprofit and private hospitals. And locations. So I decided to look at locations, and I drew up a map from Maryland, from American Health Services, and therefore it came with the counties. So I assigned each hospital to a county, and so therefore I was able to relate or differentiate which of the hospitals are Central Maryland, South Maryland, Southern, Eastern, and Western Maryland. And two groups were higher. The Central and South Maryland have the biggest groups within this study. And then to see how these characteristics impact in patients' perception of care. And you will ask, how would this impact patient perception of care? Well, you know, many of these organizations, with profit or for profit, and non-profit or for profit, they have different structures how they operate. And, you know, finances make a huge impact in how care is delivered, especially when you don't have the resources at hand. So we look at communication with nurses and communication with doctors in this case, because these are the principal providers who are, you know, look at the patients on a daily basis. So I want to see what the patient has to say about these under these different characteristics. And then we look at hospital rating, 9 on 10. So again, I just want to say that I use top box responses. Top box mean the highest positive response in this case. I didn't look at, okay, you always is a top box, but then you have sometimes or never, which are at a lower type of responses. I just look at the most positive responses for each of these ratings. And that's why I say hospital rating 9 or 10. There is 1 or 2, 3 or 4, 5 or 6. So I use 9 and 10 to see the patients that were more satisfied than that. And the other one is recommend the hospital, yes or no. The question is, will you recommend the hospital to family and friends? And patients will respond yes or not. And therefore, I'm trying to see that connection, that association between the characteristic of the hospitals, putting pressure on the services that impact the patients, and under a global payment model. And the global payment model, again, is a lump sum of money given to the provider throughout the year, where they have to administrate these funds to effectively provide the service. The benefit, as well as the global budget payment, as I didn't mention before, is that whatever remains out of that budget stays with the hospital. So they have to be very efficient how they're managing that money to have that extra income there, if you will, extra revenue to be prepared for coming years as well. So that's what the model is about. And for this cross-sectional study, it's a cross-sectional study, and security data was used to examine the average rating of hospital inpatient service during 2018. So was different patients involved in this? Wasn't the same patients? We didn't follow up with that, but this study, or the database, which is public and CFS website, has data for each year. And data sets can be downloaded at any time, and all CMA is asking for you to acknowledge their site, right? And non-priority convenience, because, you know, I just used whatever was there, the data presented. I wasn't selecting based on any other characteristic what the sample should be. 41 hospitals were included in this report because some of them weren't compliant or didn't report during that time. So I had to clean the data and bring it down to that, especially when I'm working with selected variables, right? So the responses are patient rates, which is part of the requirement for the dependent variables, continuous variables. So that's used specifically for this type of study analysis. Again, I mentioned this, third-party organization sent it out. So the dependent variable are used in continuous rates, and the independent variables is what I use for the patient characteristics. Yeah. And again, that says then location and non-profit and profitable status, profit status, and if they have an emergency room or not. That's the other thing that we'll look at. The instrument health cap survey that was mentioned too, and the variables are there. And the mention of the variables, as you can see on the screen, and I said before, and independent variables. So these are the variables that are required. For a multivariate analysis, you can use more than two or more dependent variables, and then you use one independent variable. That's the requirement to do a multivariate analysis. And my question was, do hospital characteristics significantly influence patient perception of care under a global model in Maryland during 2018, for 2018? Again, MANOVA were used to do the analysis and with these 4 variables. And then statistical analysis are used to measure the impact of one or more independent variables and many dependent variables. All right. Some of the assumptions that I before presenting data to you, I have to go through to satisfy the assumptions of the study, of this type of multivariate analysis. And as you can see, I don't have much time to explain to that, but some other time maybe, or for those that I know, so the data was homogeneous in the sense that the different groups and the rates were, you know, in line, similar. The nurse communication was normally distributed as I went through the analysis. And the assumption of Malahanovic, I did some univariate analysis as well to look at the variables to make sure that they're not outliers. And as you see there, when I do the multivariate analysis, there wasn't much there wasn't any outliers. But when I do the univariate, which is a different type of analysis, it showed that there were a couple of outliers, and that's why I say that, you know, the recommendation is to interpret the data with caution, right? With caution, depending on what we are planning to do with it. So based on the results of the test, I found that there is a statistical significant result when it comes to nurse communication with patients. And we're going to look at that. How did I get to there? Let me get down to that point right now, moving forward. So there's a table of results that show the different dependent variables and their multivariate analysis. And we can see that region across each one of these points were significant with the asterisks. That's emergency room, region, and profit orientation. And researchers say that Pillai's trace is one of the most, you know, it's better to use as it is more sensitive. So they studied the world there, and then between subject shows, if you look at where's the region, can I move this here? Yeah, region, we could see that significance where with nurse communication versus doctor's communication. So the only one that were significant were nurse communications. The other ones, emergency room wasn't significant, and multiple comparisons also show me which region were significant, eastern and southern. As you can see, eastern and southern, and we come here, southern and eastern. So we have to follow up to see why this was significant, as it's shown here on the tables. And then multiple comparisons also show, based on the dependent variable and the independent variables, shows that there was significance as well for nurse communication, as you see here, 0.017, which is below 0.05, and also down here. Doctor communication, there wasn't any significance there. And happy to share this work with you. Looking forward to advance it and to maybe come back to this audience sometime and I can share how far what we're doing with that. My contact information, if you have any questions, I'll be happy to respond to you. Thank you so much.
Thank you. Thank you. Thank you, Dr. Blanco Toppings, for the presentation. The School of Business has been represented well this morning, but there's I have a question that I would like to ask you. In your study, in your experience as a healthcare researcher, a scholar, and professor, is there any type of correlation between the cost of healthcare at a facility and patient satisfaction? So, for instance, if a patient is entering into a healthcare facility or healthcare provider and is very expensive, does that mean then will they have a direct impact in terms of the type of care or the satisfaction that is generated from that service, versus maybe the lower expensive healthcare and maybe more disgruntled or unsatisfactory response.
Thank you so much, Dr. Brown, for that question. And yes, there have been studies that look at access to care financially as well. And yes, it has an impact on the patient. And for that reason, we're doing this type of study to demonstrate that there are exogenous elements that impact the patient experience. Because if I can't pay for my service and I go into the doctor's office and looking for that care, right, and for a doctor commitment is then it's not going to happen. It's not going to happen. The doctor will say, we cannot support you. We cannot pay for you. For instance, I've seen a research study. I've read a paper about this as well, where patients with Medicaid plan go to see the doctors, and doctor says, we cannot provide the service to you. Because why? Because it has shown that there is a loss for providers when they're taking care of Medicaid patients. It's a lower return, a lower rate for the doctors, so they cannot take a chance to see these patients. Will that impact the patient perception? Of course. They will talk about care and say there's no communication, lack of communication, or they didn't have access to their care for these reasons. Others look at the profitability of the providers to determine if more profitable organizations has a better rate of return or better rate from patients and perceptions as well.
Thank you. These were some amazing presentations, and I cannot wait to see what presentations we will have this afternoon for our afternoon sessions, which will start back at 2:15. What we will have right now are poster presentations done by students that have done research at Oakwood University with our faculty. This one will be over Zoom, and the Zoom ID is actually in the program, but I do have the Zoom ID that will be put into the chat. It should be streaming at the bottom, so it will come in shortly. Here's this poster Zoom session. It's running at the bottom. So if you are interested in seeing the poster presentations, please sign in. Outside of that, we will break for lunch after that, come back to our second poster session, and then we will start back with our faculty research at 2:15. So I cannot wait to see the phenomenal studies that have been done by our faculty. Welcome back, everyone, to our second session of our research symposium. We are starting promptly now with some wonderful presentations. But of course, we have to start off our session with prayer. So let's bow your heads for prayer. Dear Lord, I just want to thank you for all that you've done. I thank you for allowing us to be here today. Please be with all the presenters and those that are listening in, that we may learn relevant information and be blessed. Thank you once again for your many blessings. Amen. I would like to bring up Dr. Lisa James, who will introduce our new speaker.
I have the privilege of introducing our next two presenters. Our first presenter is Dr. Alexander George Volkoff. Dr. Volkoff is a professor with a worldwide reputation for research in the field of interfacial chemistry and electrophysiology of plants. Dr. Volkoff has published 8 books, 50 reviews, and 210 articles in peer-reviewed journals, which include 50 articles with undergraduate students. Dr. Volkoff received grants from the National Science Foundation, NASA, the Department of Defense, and the United Negro College Fund, totaling over $7 million. Ladies and gentlemen, I present to you Dr. Volkoff.
Good afternoon. Thank you very much for your invitation. So I would like to talk about memory and learning in seeds, plants, flowers, and fruits, and this function memristor do it. So in the beginning, I need to start these definitions because for example, majority of students and faculty cannot give us exact definition of memory and learning. Plants, like humans and animals, have different forms of memory, such as sensory memory, short-term memory, and long-term memory. Definition: memory is the ability to store the state of a system at a given time and access this information at a later time. Sensory memory corresponds approximately to initial from 1 millisecond to 3 seconds after an item is perceived. Short-term memory is usually about from 10 seconds to 1 minute. And long-term memory can be for a long period of time, for even years. So possible candidates for memory in any living matter are memristos. We have memristos in seeds, plants, flowers, fruits, and a human brain and human body and in neurons. I will show you they are voltage-gated potassium channels. So how to do next slide? Okay, thank you. So this is example of the most famous plant. Originally, it's national plant in the United States, the Venus flytrap. It exists in nature only in 2 states, North and South Carolina. So when insects touch sensitive hairs inside lobes, on surface of lobes, it creates sensory electrical potential and voltage-gated ion channel amplified to action potential. Action potential is travel very fast to the midrib, and it open voltage-gated ion channels, which will go to lobes, and water follow these ions through water jets. This is water channels, aquaporins. Changing pressure in one side of lobe and another side of lobe can change convex to form, and the lobes close in 100 milliseconds. And this is transformation concave convex. When it's closest on the right side, you can see this closed Venus flytrap. We can do it without insects, because to close it, we need to submit action potential. And this, if we submit action potential in the lobe, it will close exactly the same way, the same kinetics as in nature when insect touch it. So when it close insect, nobody cannot go outside the trap, even small frogs. Why? Because when Venus flytrap closed, there is very thin line along lobes, and even small force created huge pressure. Nobody cannot avoid and escape. So it has memory. We can put, to close Venus flytrap, we need to put about 9 microcoulomb charge. We can give it one by one. We can do 4 and 4, 4 and 5, and it will close because Venus flytrap will recognize this is attacked from insect. So plants have biological clock and circadian rhythm. This is also electrical elements of memory. Many plants are able to memorize daytime, nighttime. Biological clock in plants is sensitive to light and to electrical signal transduction, which can reset the phase of the rhythm. So biological clocks and circadian rhythms were discovered first of all on plants a few 100 years ago. Now, next important definition, learning. What is learning? Learning is process of acquiring new understanding, knowledge, behavior, skills, attitudes, and preferences. The ability of learn is processed by humans, animals, plants, bacteria, and fungi. Learning in plants involves perception of a stimulus, activation of a transduction pathway. Here is diagram on left side, how insert can close venous flytrap in nature. On the right side, we can just submit electrical charge and it will be closed. About memristor. 51 years ago, my friend Leon Chue, professor of University of California at Berkeley, is the best scientist in electrical circuits. And when he started to draw a diagram between fundamental elements of electrical circuit, such as capacitor, resistor, and inductor, they have different relationship. And he found that it should be one more element, fundamental element. He called it memristor. Memristor is element resistor with memory. 37 years, nobody did not cite this work. In 2005, Hewlett-Packard did first man-made memristor, and after it started a revolution in computer science. Because it's extremely fast memory. If you press on computer, you can see everything on screen immediately. But after they found that there is a problem in computer science. Processors are very fast, memory is very fast, hard drive is very fast, but communication between them is slow. 2 years ago, I was in China. I was invited by Chinese Academy of Science University and Professor Chu for his memorial lecture and opening of Chu Research Institute. And at that time, many computer scientists start to do new type of computer. Now we understand we don't need hard drive, we don't need memory, we don't need processor. Only memristor can do everything. And problem within computer science we call bottleneck, slow communication will not exist. So this is new generation of computer will be, but we already got many Chinese, American, Japanese companies patents for memristor as a memory. Now the memristor is sum of processor, memory, and so on, and everything in one element. So circadian clock was discovered by Demaran, French astronomer, in 1729. So he likes to grow Mimosa pudica. Mimosa pudica closed leaves for a night, open for a day. But one time he forgot to switch on light, and he found that all leaves open because Mimosa pudica memorized it. So this was about biological clock memory. We know that if we fly from Huntsville to Paris, we will have problem with jet lag. First night we will wake up 3 o'clock in the morning, and at 4 o'clock in the morning we will go outside to look at Paris. Now we know it's a biological code, circadian rhythms are electrical phenomena. We can measure it. So people who go from Huntsville to Paris, they have two options. One option is to buy on a line NADH tablet for $15. And when we arrive Paris, you take this NADH and it will adjust your clock, biological clock, because it can be adjusted by donor of electrons. NADH is donor of electrons. Some people decided not to buy a tablet for $15. It's possible to do for free because in such flights from US to Paris, people have unlimited amount of alcohol. One molecule of alcohol generates one molecule of NADH. If people professional alcoholics, they don't need to do anything. They have excess of NADH and they don't have jet lag, and they can switch this biological clock without spending any money. This is Mimosa pudica. When it's dark, leaves are open. When it's light, when it's if you say switch light off, it will close all leaves. And in the morning, closed leaves will be open. And you can see this picture in ABCD. If you touch, it has also mechanical sensor, the same as the venous flytrap. Mechanism of closing leaves exactly the same. It's two-layer model. We describe a mathematical model which described all experimental data. We don't have any deviation. This Professor Markin on mechanism of closing and opening into system. This is important for creating of robots, for application in space flights and aircraft, because we found method how to change electrically different shape of this, let's say, aircraft materials, because we can electrically control shape, concave, convex, and do it. It's very easily to learn models. As soon as we publish our model, some scientists in American universities and chemical department, they immediately created such man-made materials. So how to check if biotissue has memristor? The only one way to do it. Here is example of pulvinus of Mimosa pudica. If we apply electrical wave as a sign or triangle, we will get in this diagram, depends of electrical current in biotissue on applied voltage in plant, this touch point. In this point, can be crossing or not crossing. And this is characteristic properties of memristor. There are not any other electrical element or combination of them which can do such crossing point, which is specific property of memristor. If we can use tetraethyl ammonium chloride, which is a blocker of potassium channels, we will kill this dependence because memristor will be blocked. Because we have in our brain and neurons voltage-gated potassium channels, and plants have the same. No difference between memristors in human body, in apples, in fruits, in flowers, and in students. So this is example. If you apply a charge, we can do it part by part, but as soon we will get threshold limit, it will close. So long-term memory, I will not discuss it because there are many publications about long-term memory in different plants. So actually all plants have long-term memory. All seeds have long-term memory. All flowers have long-term memory. Problem only in students. We want to give more to long-term memory information in class, but sometimes it happens, sometimes not. This is apple. This is apple organic, was grown in Alabama. This is typical apple at fall. So when you eat apple, we eat memristors, capacitors, resistors, voltage divided, many electronic elements in one apple. This is also voltamperic cyclic voltammetry of apple, and we can see pinching point, which is memristor. And if you treat this apple, inject a small amount of tetraethyl ammonium chloride, it will be block this memristor, and pinching hysteresis will disappear. This is all on top, all equivalent electrical circuit of neuron. This is all. Hodgkin and Huxley won Nobel Prize in 1961, but this is wrong. But usually you can see in the textbook and Oakwood students study this wrong circuit. Why? Because Leon Chue found that Hodgkin and Huxley had incorrectly identified the potassium ion channel as well as the sodium ion channel as a in nerve membranes and axon as a time-varying conductances. Now we know by memristors, but since it's not, nobody does not know how resistance changes in voltage-gated channel. When it closes on zero, when it's open, it maximum 100%. But how it changes in time, we don't know. And we cannot solve this problem and this equation. The lower part is correct. It has not to, it can be mathematically solved. Leon Chue already did, and he got exactly experimental data which we have in neurobiology. And this is exact, we believe that he should go to Nobel Prize because he makes so much discovery in these memristors as a new type of computers and evaluation of memristor in nature. When we meet first time, it was in Spain. We decided to check implants. It was about 8 years ago. And in 1 year, we published a few papers with our students too. We found memristor in different biological tissue. So this is example in flowers. Some patient coral hot, compact hot coral, and it has memristor in different parts of this flower. So this is in some kind of stem on which it stayed. It also it's inside flowers and memristor around everything here. I want to have not too much time, go fast. This is flowers. And this is action potential in the Venus flytrap. So in Venus flytrap, we can close also using cold plasma. It was recognized and reproduced now in many labs. But we can also drop small amount, 10 microliter hydrogen peroxide, and it will close. Why? Hydrogen peroxide will open chemically voltage-gated potential ions in the midrib, and Venus flytrap will close. And this hydrogen peroxide will induce such type of action potential with 100 millivolt. It's very similar to what you have inside your body in your neurons. What is important also, when we apply bipolar stimulation, electrical voltage, sine or triangle, we got property of memristor, but we don't know this memristor works this long-term memory or short-term memory. I try to switch next slide. Oh, if we apply to only one polarity, positive or negative, if we will have exactly the same response during here is 7 cycles, it means Venus flytrap has short-term memory, which we found before electrically. But if it will be not the same, it will increase or decrease, it will be property of long-term memory. I cannot change. No, this is another example. Can skip, we have not much. Some people who study biological clock, circadian rhythms, they don't know because they don't measure electrical characteristics, but plant going to sleep, if I have light 6 o'clock in the morning until 6 at evening, we're not going to sleep at 6. We start to prepare to sleep at 4. So if you want to get during the day reproducible results, we should do experiment from 10 to 4. Charles Darwin found something similar, but he didn't know its electrical effect. So before to go to sleep, it close slowly one by one your ion channels. It has family of 12 voltage-gated potassium channels, and it's at 6 o'clock it's start to sleep. The same in the morning. Plants start to prepare for day before light will start. It will activate ion channels. And after it will open pores, everything, stomata. But it's not one moment. So I have just 1 minute. I can skip many slides. This is aloe vera's internal structure. So this is about pharmaceutical. We can find mechanism when we apply specific inhibitors for different ion channels. So this is what is tragic event in Oakwood University. We start to work with students as a family. They got results. They published articles in peer-reviewed journals. They do international presentation, and after they going to different universities. And we are losing the best of them. Here is students who already graduated last couple of years, except 2 students, Hairston on top on left, and Jada on bottom, and Lincoln, they will graduate in a few days. So for next year, I have only 1 student from this year, but he already published 1 paper, and second will be published soon. Thank you very much.
Very, very interesting, Dr. Volkov. You know, I never thought about plants having memory or, being able to learn. But there's a question that was asked, and the question is, does exposure to street light affect circadian rhythms and memory of plants?
If it's low, very low intensity, it will not influence. But if there is some threshold when it will start to work. And we can easily to measure it because we do experiment, it's 10 seconds. And during 10 seconds, we do 1 million of measurements per second. And we have high resolution results and everything on screen. But generally, why some people, when we talk about memory of electric, we believe that people are better than others. But generally, let's say if I will be creative, I will do everything in the same way. And now plants have the same enzymes, the same ion channels. Difference in plants, instead of neuron, we say phloem. But inside it's the same voltage-gated ion channels. The same as our neurons.
Our next presenter is Dr. Stephen Kaba. I apologize, Dr. Stephen Kaba. Dr. Kaba is an assistant professor of communication and the coordinator of the Communication Arts program at Oakwood University. He is an innovative communication, business, and finance professional with years of progressive experience in the public and private sector. He holds a Master of Divinity degree, Master of Business Administration, and a PhD in communication with an emphasis in digital media. He has presented several academic and scholarly papers at the Association for Education in Journalism and Mass Communication and at the Broadcast Education Association Conference. Dr. Kaba's principal research interests include mediatization, media effects, media ecology, digital media, and new media. His goal and passion in life is to bring an awareness of the impact and effects of media on culture and society. Dr. Kaba will talk to us today about mediatization theory, a quantitative investigation on the...
Thank you very much, Dr. Lisa, for the introduction. And it's a privilege and an honor to be here and present these paper or this research. And so as she has just said, I would like to see my presentation right there so that I can proceed. Okay. The title of the research is Mediatization Theory, a quantitative investigation on the role of social media on marriage well-being. And so mediatization theory is a new theory. And this research is a quantitative investigation on the role social media plays on marriage. And so when we look at marriage relationship, a marriage relationship should be people who are connected. But now we are living in the era of digital media where a marriage is supposed to be connected, but actually we may not know that we are disconnected. There are many ways that we can be disconnected. And so the reason for this investigation is the role that social media plays in marriage well-being. And on the next slide, the purpose of the study is to explore the relationship between social media platforms and the mediatization of one of the most important human relationship, and that is the marriage relationship. And so this study will further seek to investigate the role of social media, what role social media plays in the ever-changing dynamics of marriage, of course, through the lens of mediatization theory. And so here is the study framework. Of course, mediatization is the influence media exert on culture and society. We'll see the impacts of media effects. Of course, we'll look at social media and media environments, which is a media ecology. On the next slide, this is the theoretical framework. This study will look at 3 theories. And by the way, mediatization is a new theory. And so mediatization theory, of course, like I said, is the influence media exert on culture and society. The other theory that we will be looking at is the uses and gratification theory, which individuals actively seek out media specific to satisfy specific needs. And the last theory will be the social comparison theory, which of course people determine their own social and personal worth based on how they stack up against others. So when we look at a marriage relationship, we'll see people comparing their marriages with other people on social media. And that's why social comparison theory comes in. Mediatization theory comes in because we live in a culture where we are influenced by media. We take orders from media. We can't operate without technology. We can't operate without our phones and stuff like that. And so this is the theoretical framework of this research. On the next slide, we are in the significance and the rationale of the study. And this is very, very important. Number one, according to Thomas and Hawson, it is more likely for heterosexual couples to meet online than through personal contacts and connections. These days, there are so many dating apps. And so it's a new form of dating. It's a new form of interaction where people are meeting. And so that makes this study very, very significant. Also, we are living in the era of digital communication, digital transformation. And also, lastly, digital intimacy. We are so much attached to our devices, our phones, the technology. And so what we call infidelity is changing every single day. There is what we call digital infidelity, which is a form of emotional infidelity, which is in today's scholarly world, it's being redefined every day. So on the next slide, we are in the new era of digital transformation. So for the last couple of years, culture and society have been ushered into a new era of digital transformation where we have to take orders from technology, seek authorization from technology, and find satisfaction in technology. And that's why these research and study is very, very important. So in this research, I looked on 7 hypotheses, which we will evaluate. On the next slide, hypothesis number 1 that we will analyze: the greater the social media use of a marriage partner, the more unstable his or her marriage will be. So it is very clear, according to these findings, that the more one partner uses social media, there is a likelihood of their marriage to be unstable. Hypothesis number 2, more frequent and habitual use of social media by married individuals, that is, when both of them are using social media, there is a likelihood of marriage instability. Hypothesis number 3, the more a married partner compares his or her marriage relationship with that of others on social media, the more he or she will experience marriage instability. And this is where the social comparison theory comes in. When people go on Instagram, they're comparing their marriage with other couples out there. And so hypothesis number 3 is very, very important. On the next slide, we have hypothesis number 5. individuals are more likely to use social media frequently if they have not taken a class or seminar on media literacy. And this is where media literacy comes into play. And hypothesis number 6, individuals are more likely to become technology dependent if they have not taken a class or seminar on media literacy. And the last hypothesis that we will look at is individuals are more likely to habitually use social media if they have not taken a class or seminar on media literacy. Now, on the next slide, we will be looking at the method that I used for this research. And the method in play is quantitative research methodology. And on the next slide, you will see the participants that were involved in the study. On the next slide, the participants of this study were adults aged 18 or older, residing in the United States of America. The participants were either currently married or had been previously married and currently or previously used social media platforms while in a romantic relationship. So while collecting data, we made sure that you have either been married, you've used social media, or you are currently married. On the next slide, this is the demographic information. We had 531 participants that we collected data from. We had 272 females, 258 males. In terms of ratio demographic, we had 32% Caucasian, 14% Hispanic, 26% mostly Black or African American, 16% Asian, and other ethnicity constituted 9.6%. So while collecting data, because we use a survey to collect data, I made use of 3 measurement scales, as you can see on the next slide. The first measurement scale is the media and technology usage and attitude scale. This was used to measure social media engagement with the participants. Of course, I had to find a way in which they were engaged on different social media platforms. The second scale was the USGS, which is the uses and gratification of social networking sites, which is used to assess individual motivations for using social media networking sites. And this goes to why are married couples using social media? What's the reason? And so this measurement scale was very, very important. And the other scale is the RC, if you go back to the other slide, was the RSCM, which is the relationship and social comparison measure, which was used to evaluate the extent to which married couples compare their relationship with others on social media. And that's why the social comparison theory is very, very important in this study. So to collect data, on the next slide, SPSS version 26 was used to collect the necessary data for evaluation. Now, as you can see here, the variables in play on the next slide. Once I did the matrix of correlation coefficient, all variables correlate with each other. So there is a relationship between all the variables. That is on the x-axis and also on the y-axis on top. So there is a correlation which shows that the research or this finding is very, very significant. On the next slide, I did the skewness or kurtosis for all variables. They were all within acceptable range of normality. There was just a very slight deviation on the case of social media usage, as you can see there, just a slight deviation, but that did not affect the research finding at all. So On the next slide, here now are the results. Now, before the results, a reliability test was run. A reliability test assesses the degree of consistency between multiple measurements of a variable. So for the purpose of this study, internal consistency was measured using the Cronbach's alpha item to total correlations and inter-item correlation. This is very important when you're doing any quantitative study, to have a reliability test to see if your findings are in any way reliable or not. So on the next slide, you can see there the minimum Cronbach's alpha is 0.7. So on that right there, you can see that all the tests were reliable because they were within the minimum acceptable range, while the inter-item correlation should not exceed 0.3. I mean, should exceed 0.3, and you can see right there, it was reliable right there. And also for the item to total correlation, it's right there. So the reliability, I'm trying to put it back to where it was, if somebody can help me, right there. It shows that the tests that were run were all reliable. So on the next slide, I'll try to go a little bit faster. The first hypothesis was testing the effects of social media use on marriage. So the first hypothesis predicted that the greater the social media use of a marriage partner, the more unstable his or her marriage will be. And so to evaluate this hypothesis, two regression analyses were run. The regression model was executed with marriage instability as a dependent variable and the partner's usage of social media as an independent variable. And here are the results on the next slide. As you can see, the partner's use of social media explains 27.9% of the variance in marriage instability, which actually shows that the more a partner uses social media, the more unstable their marriage could be. And I wish we had more time to explore that. If you have a p-value of less than 0.01, it shows that the regression was supported. And so as you move on the next slide, to further explore H1, we looked at the violation of normality or linearity. And so a PP plot was used to assess this. And as you can see on the next slide. So there's, as you can see, no strong evidence that the assumption, any assumption was violated. As you can see, there is that diagonal line. There was no moving further from the diagonal line, which shows that H1 is really supported. You can see it on the PP plot and also on the scatter plot. Now, on the next slide, the second regression, as you can see right there, still looking at the effects of social media use on marriage, the overall regression was really significant with 72% of the variance. As you can see on the adjusted R square, it's 0.72, which explains 72% of variance, which shows that the more one partner uses social media, there is a likelihood of marriage instability. And also the p-value is less than 0.01, which means that this regression is supported. On the next slide, you can see the PP plot and the scatter plot. They showed no substantial departure from normality, which of course gives weight to H1. On the next slide, the second hypothesis predicted the more a marriage partner compares his or her marriage relationship with that of others on social media, the more he or she will experience marriage instability. This is on social comparison theory. Of course, that was very much on the literature review. And so to examine this hypothesis, a regression analysis was run. On the next slide, as you can see here, the model was significant with 0.556, that is 55.6% of the variance is explained, as you can see on the adjusted R square. So it's the hypothesis is supported that the more couples compare their marriages with others on social media, be it on Instagram, Facebook, there is a likelihood of instability. On the next slide, you can see there is no substantial departure from normality, as you can see on the PP plot on the diagonal line right there. On the next slide, on H3, that hypothesis predicted that frequent and habitual use of social media for married individuals also leads to marriage instability. And also to analyze this, a regression analysis was run. On the next slide, I'll try to be really quick now here. 58.5% of variance is explained, which means the hypothesis is supported. On the next slide, we can see on this one, when it comes to social comparison, there is a slight deviation from normality. It's present. And so the points depart slightly from the diagonal line. And by the way, you can notice it also on the scatter plot. But still, because 58.8% of variance is explained on the regression analysis, also show that this hypothesis is supported. On the next slide, the fourth hypothesis predicted that the habitual use of digital communication technology creates an addiction-like dependence among individuals. To explore this hypothesis, by the way, for H4, we ran a simple linear regression. This is on technology addiction. And on the next slide, you will see that it is supported. The overall regression model was significant with a p-value with the beta coefficient of 0.6 and the p-value of 0.001, which means the hypothesis was confirmed. The more you use social media, the more dependent you will be on also digital technology devices. On the next slide, this is on social comparison. There is a slight lack of normality, as you can see on the PP plot. And on the next slide, to run the rest of the hypothesis, the H5, H6, and H7, individuals are more likely to use social media frequently if they are not aware of media literacy. And so to run this hypothesis, what I did is just to run independent sample t-tests. And on the next slide, you will see right there that based on the number of people sampled, you will see that H5, H6, and H7 is supported. If you're not familiar with media literacy, then you're more likely to be addicted to the use of social media platforms and other digital technologies. And on the next slide, the discussion, I'll do it in 1 minute only, if you would mind to move forward. The themes that are being discussed here, if you move to the next slide, I believe, yes, right there, social media digital intimacy, a review of existing literature and the regression analysis conducted for H1 and H3 revealed that social media digital intimacy and mediatization affects marriage well-being significantly. There is a direct and strong relationship between social media use and marriage instability. And so the study findings show that couples who are more active on social media platforms have higher chances of conflicts and instability in their union. On the next theme, H1 and H3 reveal that if one partner frequently uses social media or is a habitual user, it could result also to marriage instability. The positive predictive relationship between marriage instability and social media usage was seen in social media patterns and social media usage habits. Would you mind to skip 3 slides as I come to a conclusion? Keep skipping. Right there. Keep speaking. Skip one more. Right there. So what's the contribution to communication theory? Individual social relationships and daily practices are a reflection of views communicated and emphasized by media. And lastly, the limitation for this research is that the study created latent variables from self-reported social media use. We used MTAG to collect data, but also some data was self-reported, and which was a key limitation, which for future research, it would be great to not have self-reported variables. And so I will end there and I will take a few more questions. I wish I had more time, but we'll go from there next time.
Wow, another interesting presentation. Thank you, Dr. Kaba. I have a question about, I know you talked a little bit about the future research. I guess my question is more about the use of the results of this. Exactly, I know that there are a lot of people who need to hear this, for one. And it's great to see something that we probably already kind of had an idea was happening, but to see the actual data, it's really great to see. So I believe this is a great study. But as far as using the results to help other people, what are your plans? I don't know if I'm saying that correctly.
Thank you very much. It was in part of one of my slides. And this data, I think it is very important for pastors and who are ministering to congregations. And so I think there has been a disregard of the impact social media has on marriage well-being. And so if people, media literacy becomes a very important aspect that needs to be introduced not only in schools, but also in churches, or in other places, that would go a great way for people to know the media effects. Once they understand the dangers, there's a rabbit hole that can lead you to places that you should not go. I think it would go a great way. And so this data is available and can be shared in different ways.
Hello, everyone. Next, we'll hear from Dr. Chandra Tyler Mountain. I'm very pleased to present and introduce her to you today. Dr. Chandra Tyler Mountain is Dean of the School of Arts and Sciences and Associate Professor of English at Oakwood University. She is a graduate of Oakwood College, now University, Bachelor of Arts, and the University of Florida, Masters of Arts and Doctor of Philosophy. She has served in academia for nearly 28 years in the capacities of Professor, Chair, Assistant Dean, Dean, and Assistant Vice President of Academic Administration. Her experience is broad and comprehensive. Her scholarly expertise lies in literary theory and women's Africana and British literatures. She has been exploring the subjects of women's empowerment and liberation, madness, cyclical violence, and trauma in literature for well over 2 decades, and has written, presented, and lectured on topics extensively. As a creative writer, she writes poetry, short prose, inspiration, and creative nonfiction. She also maintains Pics and Posts, IamChandralyn.com, a weblog about snail mail, photography, and the beautiful facts of life. Today, we will hear her work on Work What You've Got, Womanhood, Constraints, and Power in 2 19th Century Texts. Welcome.
Thank you, Dr. Richardson, for that introduction. So I'm going to be talking on the topic, Work What You've Got, Womanhood, Constraints, and Power in 2 19th Century Women's Texts. So I'm going to be talking about a text by Hannah Kulik, who is the woman on the left, who's dressed in a man's suit. She is a British woman in the 19th century, and the person on the right
is Harriet Jacobs, a 19th century African American woman living in the United States. So the project considers the diaries of Hannah Culloch, a Victorian maidservant, alongside an African American slave narrative, Incidents in the Life of a Slave Girl. Through the study of specific passages of incidents, the project studies not only the connections and disconnections between two classes of women living on opposite sides of the Atlantic, but also examines the patriarchal male-female master-slave binary and the diarist and narrator's disruption of those structures. Through such examination, the project positions the two very different women at the forefront of discussions on race, class, and gender in the 19th century, and invites us to participate in the conversation about popular notions of Black and white women during the 19th century. So the first book that we're looking at is The Diaries of Hannah Culloch. It consists of, her entire library of diaries consists of 17 diaries written over a 19-year period from 1854 to 1873. 8 of the diaries are included in the book that you see pictured to the left. And this book was edited by Liz Stanley. Her audience was Arthur Munby, who was her employer, a little later became her lover and then her husband. The diaries were written at his behest so that he could keep up with her daily drudgery and other activities. Eventually, the diaries became just as much for Hannah as they were for Munby. She uses them to work through her thoughts to influence him in certain ways. Then Incidents in the Life of a Slave Girl is the second work. It is Harriet Jacobs' autobiography, published in 1861. It is the most widely read female antebellum slave narrative. It is written for a white audience and used to promote the cause of abolition, and it appeals to northern white female readers. She offers a portrayal of her life using the pseudonym Linda Brent under the predatory Dr. Flint. She documents the sexual abuse she suffered, but she also explains how she uses her sexuality as a means of avoiding exploitation by her master. The core of Jacob's narrative is her defense of her own loss of virtue. Her narrative foregrounds issues of her condition or slave, and consciousness, a sense of self in which the condition of enslaved exerts differing degrees of influence on the concept of self. She presents a decidedly female-centered slave narrative and addresses the constraints of motherhood and sexual agency under a system of slavery. So what's undergirding this work is certain 18th, 19th century philosophies about race and gender. And they're undergirded by this idea that both white women and Black men and women are inferior to white men. And so you see just a couple of quotes in these slides. The Diaries of Hannah Culloch, Victorian maidservant, and Harriet Jacobs' Incidents in the Life of a Slave Girl present to us two unique situations for women in the 19th century. One, a Victorian scullery maid who eventually marries her massa. The other, an enslaved young woman who is so harassed by her master for sexual favors that she mothers a child with another white man, fakes her escape, and hides out for 7 years in a dark, narrow loophole of retreat before making her way to freedom. Each writes a narrative which on the surface outlines her day-to-day life as servant and slave, but which powerfully reveals how she broke through societal constraints and defined and carved her own path to freedom. The narrative, skipping a little bit. When you write a paper that's 30 pages and you have to reduce it to 15, 20 minutes, you have to skip a bit. By referring to herself as massa slave, Hannah Culloch unwittingly acknowledges sisterhood with all womankind and underscores Mary Wollstonecraft's assertion in Vindication of the Rights of Women that all women are slaves. Curiously and contrarily, Hannah is clear in her distinction of ladies and servants and unwavering in her position that she does not wish to be a lady or to even consort with them. With such labeling as massa slave, she seemingly accepts her position as enslaved to the patriarchal structure of society, which maintains the natural inferiority of women in relation to men. However, while Hannah establishes Massa's ownership of her as a work tool and as an article of property, she is inferior only to Massa. For all others, she comports herself as an equal, and to men of her class as a superior. Her privilege of being Massa's slave, coupled with the blackening of her skin and the padlock around her neck, lead us to other implications of Hannah's label. The image evokes images of the enslaved Black person. Indeed, Hannah was a white, free woman living in England, so this connection may seem to fail in logic. However, an analysis of the diaries reveals the striking similarities between the life and role of a Victorian maidservant and the enslaved woman. Hannah's obvious willingness to serve Munby and comply with the codes of servitude and slavery seem to negate any argument I may have, but her acceptance of the social and ideological constraints does not remove her status as slave, nor does it attest to her complete powerlessness to defend herself against such socialization. Rather, her complacence demonstrates her use of the marginality imposed on her as a site of resistance, as Bell Hooks terms it, or a location of openness and possibility despite the oppressive structure of society. Once we understand Hannah in relation to her enslaved status, we can see connections between her diaries and a form of African-American autobiography known as the slave narrative, and her status, of course, as a slave. For that purpose, Harriet Jacobs' incidents in the life of a slave girl is more than adequate as a point of comparison. Numerous essays and books have been devoted to defining and limiting the slave narrative. James Oney offers a master outline of the slave narrative in his essay, I Was Born, The Slave Narratives, Their Status as Autobiography and as Literature. Robert Steptoe's From Behind the Veil provides an avenue by which we can allow Hannah's diaries into this genre. Steptoe categorizes slave narratives based on how authenticating documents are used in the narrative, whether the narrative subsumes or is subsumed by the documents, and whether the documents are integrated or appended to the text. While Steptoe and Oney are concerned with the form of the narrative, William Andrews concerns himself with the social and political issues raised in the narrative. He writes, autobiography became a very public way of declaring oneself free, of redefining freedom and then assigning it to oneself in defiance of one's bonds to the past, or the social, political, and sometimes moral exigencies of the present. It is in the light of Andrews' quote from To Tell a Free Story that most of the realities and similarities between Hannah's narrative and Jacob's narrative become obvious. Specifically, slave narratives were not accepted solely on their own merits because Blacks were considered inveterate liars. Slave narratives which lacked the support or authenticating voice of some benevolent white person were often regarded suspiciously, especially when the enslaved person's experience seemed incredible to his or her white audience. Although slave narrators wrote in protestation of slavery, they could not inject their own feelings and opinions of the conditions of society. They had to assume a position that would gain white sympathy and that would not arouse suspicion. This position meant self-effacement. In fact, many slave narrators use modesty and apology for their poverty of expression as a rhetorical ploy, as Jacobs does in her preface. She writes, I wish I were more competent to the task I have undertaken, but I trust my readers will excuse my deficiencies in consideration of the circumstances. I was born and reared in slavery. Since I've been at North, it has been necessary for me to work diligently for my own support and the education of my children. This has not left me much leisure to make up for the loss of early opportunities to improve myself. Hannah also uses this ploy for her own purposes. Massa's always interested in hearing about my life, and so I'd like to talk of it now. I used to think it was too low to be interesting, the same as I thought myself too low to be noticed or really cared for. Like I know M cares for me now. And she writes similarly throughout her diaries. A significant distinction between Hannah's use of these tactics is that Hannah's reasons for writing the diaries are apolitical. However, she does appeal to Munby through her ploys. In these passages, she illustrates her humility to the point of performing a task she does not enjoy, which she knows pleases Munby. She also appeals to Munby to relieve her of the drudgery associated with writing. For the enslaved person, this type of effacement meant an audience with abolitionists and white sympathists, and guaranteed an authenticating voice. They were able to articulate to an audience their own experience, even if it had to be validated through some trustworthy person. Thus, the experience of slaves or lower class women enlightened society about its racist, sexist, and classist failings without overtly claiming to do so. The success of the narrative depended largely on the ability of the autobiographer to develop a writing voice that negotiated a potentially hostile discursive environment in a manner that, in effect, created a sympathetic audience. Henry Louis Gates, points out that the intent and premise of the slave narrative was to give a picture of slavery as it is. Similarly, Liz Stanley, editor of the diary, says that the diaries bring home to us what it meant to live and work as a lower class woman in service in early and middle Victorian England. The diaries describe the drudgery of everyday life for a Victorian maidservant, but they also describe the habits and tendencies of this maidservant with her lover of 18 years and her husband of 36, Arthur Munby, which has more serious social implications. Other voices operate in Hannah's text. The diaries are hardly ever, if ever, discussed without reference to Munby's journals. These voices bring the political content of Hannah's diaries to the forefront. Liz Stanley, the authenticating voice, comments on and interprets the text throughout. Her voice somewhat controls readers' perception and reception of Hannah's life. Like the enslaved person's voice, Hannah's voice cannot stand on its own. Stanley validates Hannah's diaries and establishes them as historical evidence, rather than just the personal record of an obscure Victorian individual. The diaries, like the slave narrative, gave not only a voice, but a face to the masses of women who were entrenched in the slavery of lower class servitude. Although Hannah's experience is a bit out of the ordinary, on a basic level, Hannah, like enslaved persons, was not just an individual speaking of her experience, rather she spoke for the collective group. The diaries of Hannah Kulik parallel Jacob's narrative in three essential ways: the principle of ownership, primary constructions of womanhood, and the use of marginality as a site of resistance. The obvious parallel is that of ownership. Slaves were purchased at auctions for the most part, along with horses and cattle. Hannah describes the Soho Bazaar as a type of auction in which servants seeking work were displayed before ladies seeking servants. Hannah is Massa's. Hannah is Massa's. She wears a padlock and chain to establish his possession of her. The padlock and chain also suggest savage or animal behavior which need to be tamed. The association of slaves as property is linked to the inability of animals to reason, the blind loyalty of animals showed to humans, and the ability of humans to domesticate or train animals. Hannah's concession to Munby's strange inclinations enslaves her. Though she is capable of reasoning, Hannah's need for Munby's love allowed him to train and manipulate her to become the lowest type of person. The idea of ownership and property is linked to Hannah's obsession with being seen in her dirt or advertising her humility. She writes, "Miss Julia used to like seeing me as one would be amused with a child or small animal. It is important that Munby see her and approve of her hard labor and humility, which were evident in the blackness of her appearance. She often walked about the streets blacked up. Munby acts as an overseer as well as Massa, but the method he uses in overseeing her work, since he could not be there, requiring her to keep records of her day-to-day life, contributed to Hannah's drudgery. But Hannah continued to write because, in her words, it is not life to me at all if M isn't nice to me." The language of display and advertising and overseeing is evident in the journal in other areas, but I suspect that Hannah sought display only after learning of the values of lowliness from Munby. Munby socially manipulated Hannah by using moral bases to teach her the value of humility and servitude. In the same manner, slave masters used God to justify the degradation of slavery. As Jacobs writes, they seem to satisfy their consciences with the doctrine that God created Africans to be slaves. The female slave narrative is replete with more complex strands. The first of which is the construction of Black in relation to white womanhood or true womanhood. Black female slaves endured special problems, as Jacob illustrates. She writes, "No pen can give adequate description to the all-pervading corruption produced by slavery. The slave girl is reared in an atmosphere of licentiousness and fear. The lash and foul talk of her master and his sons are her teachers. When she is 14 or 15, her owner or his sons, or the overseer, or perhaps all of them, begin to bribe her with presents. If these fail to accomplish their purpose, she is whipped or starved into submission to their will. She may have had religious principles inculcated by some pious mother or grandmother, or some good mistress. She may have had a lover whose good opinion and peace of mind are dear to her heart. Or the profligate men who have power over her may be exceedingly odious to her, but resistance is hopeless." Barbara Welter, a feminist historian, characterizes the basic tenets of the cult of true womanhood. The attributes of true womanhood by which a woman judged herself and was judged by her husband and society could be divided into 4 cardinal virtues: piety, purity, submissiveness, and domesticity. With them was promised happiness and power. That's quoted in Hazel Carby. Written between the lines of these virtues is protection and freedom, all of which are denied the female slave, as is evident in Jacob's testimony of the trial of her life. Black women could not belong to the cult of true womanhood because they were not considered human. The virtues Welter lists were associated with an abiding presence, which consisted of fair hair and celestial blue eyes, none of which most enslaved women possessed. In fact, the slave woman's physical appearance was evidence of her depravity. Thus, the Black woman was constructed in opposition to the white woman. Rather, the construction of white woman was based on perceptions of Black women. Such a cult also excluded working class and lower class women. Hannah notes these differences throughout her journal. She's not only pointing out physical, but also sociological differences. Carby points out that within the discourse of true womanhood, wifehood and motherhood were glorified as the purpose of women's being, that it was necessary to repress all overt sexuality. Jacobs did not seek sexual pleasure, but she turned to sex to gain protection. Hannah, however, admitted to sexual pleasures, not only with Munby, but with men of her own class. Although they were taught, as Jacobs points out, the values of true womanhood, it was deemed a crime for a slave girl to wish to be virtuous. Home, marriage, protection, and law, the elements of true womanhood, were denied her, yet she was often judged by the same standards. Similarly, lower class women of England were often viewed in terms of fallen women instead of the angel of the house. Their whiteness did not protect them from the lecherous appetite, pressures, and manipulation of so-called gentlemen. For Jacobs, the want of protection from Dr. Flint, her owner, and the security of home and family led her to transgress the values of the so-called true womanhood by entering sexual relations with another white man, Mr. Sands. She hoped to end Dr. Flint's attempts to deflower her. Jacobs learns, like Hannah, her act is a necessary one for her own protection, and she also learns she cannot assign middle-class white values to herself. Hannah rejects Victorian feminine ideology and embraces a new freedom for herself. The very idea of going out in public in her dirt was offensive and signified a vile person. She even goes as far as to express pleasure in her sexuality and is able to act on her sexual inclinations without the guilt of middle-class women. So Munby, who enslaves her, also allows her freedom. Hannah equates freedom with true lowliness and can therefore boast of being the blackest servant on the street. True lowliness has no connection to the idealization of ladies, so Hannah was free to be herself. I'm going to skip just about. Hannah and Jacobs maintained a stubborn will and freedom from societal expectations. In fact, The servant and the enslaved made much of their transgressions of Christian morality, but made no attempts to apologize for their behavior because they were not caught up in societal values. Although Jacob struggled with the question of her virtue, she concluded that she stands pure before God because she stands pure before God because she was not offered the same privileges of womanhood. Jacob's owner, Flint, told her that she was made for his use, made to obey his command in everything, that she was nothing but a slave whose will must and should surrender to his. Flint's monstrous obsession with controlling Jacob's sexuality echoes the way in which Munby sought to control Hannah and the way in which men manipulated women throughout the ages. The slave narratives and the diaries of Hannah Culloch as slave narrative confront these issues and claim a freedom from all patriarchal constraints. Thank you.
Thank you so much for that wonderful paper. I'm going to ask a question, and I'm not sure if there are any online. I'm sure I could be told about that. No? Okay. So I really enjoyed this perspective that you shared with us today. I think about just depending on one's upbringing and social point in the world, you might have an opinion on the same subject, even though you may be thought of as it could be different, because what would you know about it if you're a white woman in London versus a slave in America from Africa, right? But I was just thinking, I wanted to know your perspective on what, I guess, advice or what did you learn from these readings, and what can you offer to people today who may feel like they have mental slavery from the different social impacts of society and what's going on in our world today? What can we learn from these different perspectives that these two women experience?
First of all, I think you asked a question that's probably way out of my league. Might need some sociologists in here to answer that question. But I do believe that literature is a place from which we can learn a lot, not only about individuals in the past, but also from learn about ourselves and how we should navigate society and how we should navigate life. We know that certain standards are set up without people of color in mind, right? There is a standard, quote unquote, that really often seeks to deny our humanity. How we navigate that, I think that's personal and that's individual. So I really can't, I really feel uncomfortable with giving answers about those sorts of things. But I know my answer is to always keep my thumb to the pulse of the world, and also to not allow myself to be defined by what the world says I am. And since I am obviously a Christian, then always make sure that my self-definitions springboard from who God says I am. And then everything else, just sort of falls in place. But I do believe that we should challenge certain types of statements about Black women, lower class women, et cetera, et cetera, et cetera. I think that we should challenge them through our words. We should challenge them through our work, our scholarly work, et cetera. Okay.
All right, and I'd like to introduce, I believe this is our final presenter for the symposium. He is Dr. Roman Lasmo, and he is an associate professor of English at Oakwood University here in Alabama. He teaches linguistics, English as a second language, or ESL, and freshman composition. He holds a PhD in applied linguistics from Northern Arizona University in 2018 and has several years of experience teaching English and linguistics in the US and Russia. His research interests include second language listening assessment and research methods for applied linguistics. Today, you'll hear his work on the predictive validity of TOEFL or TOEFL, our relationship between TOEFL scores and students' academic success. Welcome, Doctor.
Okay, hello everyone. Let's talk today about the relationship between the TOEFL IBT scores and students' academic success. As you probably know, in the United States of America, incoming international college students must take the test of TOEFL as a test of English as a foreign language, commonly referred to as TOEFL. and it measures students' academic English proficiency. The most recent version of this test, TOEFL IBT, is internet-based and aims to assess students' academic English proficiency in 4 areas, including reading, listening, speaking, and writing. And each section generates a score from 0 to 30, and with a total score ranging from 0 to 120. On the next slide, you will see a schematic structure of the TOEFL IBT test. So students first have to take a reading section of the test, which takes about an hour. Then it is followed by another hour of listening to academic lectures and answering comprehension questions. After a 10-minute break, students normally take a speaking section, which is 20 minutes long, and it's followed by a writing section, which takes 15 minutes. So overall, this TOEFL IBT test is about a 4-hour commitment. So most universities in the United States use TOEFL scores for admission purposes. For example, if an undergraduate international student reaches a certain predetermined benchmark score on the TOEFL, he or she can be granted admission. And different universities use different benchmark requirements, which range from 60 for small private universities such as Oakwood University, and to the low 100s for high-profile universities such as Yale University. Until very recently, Oakwood University required a score of 60 for admission purposes. This year, however, this standard has been raised to 100. So if students score lower than the expected benchmark, some universities may offer a conditional admission requiring the student to complete a remedial English as a second language course or ESL course before taking mainstream courses or while taking mainstream courses. So overall, I hope you can see that the TOEFL IBT is a high-stakes test due to its power to determine the future of a particular student in the context of higher education in America and in other English-speaking countries like Australia, New Zealand, Canada, and the UK. So because TOEFL is so impactful and so popular with students, its validity is of primary importance to the stakeholders. And when I say stakeholders, I mean everyone who is directly or indirectly involved with the test, such as students, professors, parents, and test developers. So validity, what is validity? Validity refers to whether the assessment instrument actually measures what it purports to measure, if it actually measures what it is supposed to measure. And validity of an assessment instrument can be described in different ways. It has different dimensions, and one of those dimensions is predictive validity. And predictive validity is about whether or not the test is capable of predicting real-life performance of a student in the target domain. So let me give you an example. For example, if test takers' performance on the TOEFL IBT positively correlated with their subsequent academic success, which can be measured by grade point average or GPA, then this correlation would show that the TOEFL IBT has predictive validity because college readiness is something that the test intends to measure. In addition to using GPA as an indicator of student success, other studies used different indicators, such as final grades for courses, or some measure of student retention, the number of credit hours taken or completed by students. So if these indicators correlate with TOEFL scores, that would demonstrate that the TOEFL is one of the factors that predict students' academic performance. So a number of studies have investigated the predictive validity of TOEFL and most of them use GPA as an indicator of academic success. And their results indicate that many students actually found positive, meaningful correlation between students' TOEFL scores and GPAs. You can see Bridgman et al., Cho and Bridgman, Ginther and Yan, Harsh, Hill et al., and others. However, some studies found weak or negative correlations. So we can see there are conflicting findings in a way. The research also suggests that the relationship between TOEFL scores and academic success is impacted by other variables like academic discipline, or student nationality, or university-provided remedial language support courses. The review of the literature, it seems that it exposed two main gaps in the literature about the TOEFL IBT and its predictive validity. The first gap relates to the conflicting findings, suggesting that more research is needed and should be done in this area. Secondly, very few or few to no studies have investigated the validity of TOEFL IBT in the context of a historically Black college or university. And it is important to know if the TOEFL IBT is as valid in an HBCU context as it is in other contexts and environments. So the present study aimed to bridge these gaps by investigating the relationship between the TOEFL IBT scores from international students at an HBCU, Oakwood University, and their academic success as measured by GPA, freshman courses, final grades for freshman courses, freshman composition courses, and the number of credit hours completed. Accordingly, the research question, this study was guided by this research question. What is the relationship between TOEFL IBT total scores and academic success for international undergraduate students in an HBCU? To answer this question, international student data were requested and collected from Oakwood University's registrar's office in the form of a Microsoft Office spreadsheet. So there was no intervention or direct communication with subjects, and no informed consent was required, therefore. Overall, the spreadsheet received from the registrar included the data from 14 international students from 2010 to 2020. And even though Oakwood University had way more international and ESL students, more than 14, many of them, well, only 14 of them had taken the TOEFL score or had a TOEFL score on file. So the spreadsheet included the following data: the student's IBT total score, semester GPAs, overall GPA, final grades for freshman composition 1 and for freshman composition 2, attempted credit hours and earned credit hours, and some demographics like the date, when the test was taken, student's major, age, gender, and birth country. It should be noted that for 4 of the 14 students, only TOEFL CBT scores were available, which is the previous version of the TOEFL. So I had to make sure all the scores were on the same scale. So I had to convert those previous version TOEFL scores to the TOEFL IBT, the newer version scale. And for that, I used the guidelines provided by the Educational Testing Service. Due to a very small sample size, it was not possible for me to use robust statistical tests such as a multiple regression analysis. So instead, I just ran separate correlation analysis. You can see that I had 6 correlation analysis here. The first one was a correlation between the TOEFL score and the first semester GPA. The second one was the correlation between the TOEFL score and the second semester GPA. I also had correlations between the TOEFL score and overall GPA, and between the difference in attempted versus earned credit hours, between the TOEFL score and freshman composition 1 grade, and between the TOEFL score and freshman composition 2 grade. Demographic variables were not included in the analysis. Unfortunately, some assumptions were violated, such as the normality assumption. So I had to use a non-parametric equivalent test, the Spearman rank order correlation, instead of the originally planned for the Pearson product moment correlation. The assumptions for the Spearman correlation were met, including the level of measurement, paired observations, and the right relationship between the variables. Based on the results, there was only one statistically significant correlation. So only one correlation reached statistical significance, and that was the fifth correlation. So the correlation between the TOEFL score and the final grade for the freshman composition 1 course. This statistically significant correlation had the index of 0.617 with the p-value of 0.03, which is less than the required 0.05. So these numbers show that these two variables, the TOEFL scores and the freshman composition grades, shared about 38% of variance, meaning that approximately 1/3 of the variation in EN 111 freshman comp grades could be attributed or explained by the TOEFL scores. So in other words, the higher scores students received on the TOEFL, the higher grades they achieved for EN 111 freshman composition. This finding echoes the conclusions of other studies as well, studies that found a positive relationship between TOEFL and academic grades. For instance, one study found significant positive correlations between TOEFL writing subscores and grades for English freshman composition. And unluckily, the present study did not have access to the participants' scores on TOEFL subsections such as listening, speaking, reading, and writing. So it was not possible to answer the question of whether scores on a particular subsection correlate with freshman composition scores. Furthermore, a post hoc line-by-line analysis of the data revealed that most students who got a B or higher for the freshman composition 1 course also scored 60 or higher on the TOEFL, and those who achieved a C+ or lower on the freshman composition course also scored lower than 60 on TOEFL. This trend seems to suggest that for students admitted to Oakwood University with a low TOEFL score, the freshman composition was more of a struggle than for students who got a higher TOEFL score. This pattern demonstrates the predictive power of the TOEFL IBT and serves as evidence for the validity of TOEFL scores. I should also mention that other relationships, the other correlations were also positive, especially between the TOEFL scores and the difference in the attempted versus earned credit hours. But those correlations did not reach statistical significance, partly because of the sample size was so small. So what do these findings mean for the field? What do they mean for HBCU universities? And what do they mean for Oakwood in particular? Well, first, the positive relationship between TOEFL scores and freshman composition grades suggests that the TOEFL IBT has predictive validity when used in an HBCU environment, in an HBCU context. But we need to keep in mind that because the sample size of this study was extremely small, the findings should be interpreted with caution, and they should be considered tentative and in no way definitive. That means that more research should be done to confirm these findings. Another implication, the second bullet point on this slide, it relates to TOEFL admission standards. The patterns identified in the data clearly suggest that international students' success depends on their TOEFL score. Specifically, a score lower than 60 seems to cause more pain and more struggle for students. Therefore, universities should pay close attention to their TOEFL requirements for admission and make sure that these requirements make sense and serve students well, so that they set students up for success rather than for failure. And regarding this, I'm glad that this year Oakwood University is using a higher TOEFL admission standards. Well, the study was limited in two major ways: the small sample size that I referred to previously, and for this pilot study, I only collected quantitative data. There was no qualitative data, like insights from an interview with a student or the results of a questionnaire. So future studies could use some qualitative data to provide additional insights into the relationship between the TOEFL scores and academic success. For my presentation, I used a number of scholarly sources that didn't fit on a single slide. If you would like to look over the sources that I used, please email me at rlesnov@oakwood.edu. I would be happy to chat with you about the study and show you all the sources that I used. And thank you so much for your attention and for your time. Thank you.
All right, that was wonderful information. A couple questions came to my mind, actually.
Okay.
One was, is there a comparison between native English speakers that may have difficulties with the English language or a lower grade level than college level reading and TOEFL, test takers and their academic success? That's my first question.
Okay.
A second one is, when you compare the performance in the freshman composition test versus, let's say, their math major or a biology major, or are they scoring higher on those subjects compared to their English subjects?
Okay.
And of course, we know English is important to understand those subjects, but is there like a skewing of the data?
Okay, thank you for the questions. Great questions. Regarding the first one, so native speakers of English, they don't have to take a TOEFL test, but I'm sure, and there are studies that showing that there is a relationship between standardized tests like SAT and other tests and their performance in mainstream college students. But I don't feel like I have a lot of information to share about this because this field is a little different from mine, but there is a relationship definitely. And for the second one, that was a very interesting question too, because the previous studies found that if I'm not wrong, I would have to go back and double check, but the TOEFL scores are especially relevant for majors that are more quantitatively oriented than let's say for humanities. So that's the finding that I remember. And yes, it makes sense to do this analysis by major, but I didn't have enough data to do that. Maybe that's something that I could do in the future.
Okay. And there is also one more question
Okay.
from online. I'll just read it out. What do you think is the contribution of conceptual understanding to lower TOEFL scores relative to the limited exposure to English, especially for international students?
I guess you're asking whether or not exposure to American English can help international students, even though they may have a lower TOEFL score. If that's what you're asking, yes, exposure to American English does matter, but it's not enough to justify the use of a low TOEFL admission standard, according to research. I hope that answers your question.
Yes, we would like to thank all the presenters for being here today and for presenting with our wonderful audience online, as well as those that are viewing, in person. We would like to thank you so much. And Dr. Prudence Pollard, she's actually unable to be here, but she wants to send her greetings. And I want to acknowledge everyone that is on the committee, the Faculty Development Research Symposium Planning Committee. They've worked so hard to make sure that this has gone through.
And also all the presenters who were here, and it was very interesting to hear all the research that is being conducted, not just the research, but the scholarly engagement, which is happening on our campus. All the presenters from all the different schools, they were very interesting. And also the PowerPoint, the poster presentations, the students worked very hard. I think they worked very, very hard with their faculty mentors. And that was rich, rich knowledge that was put out there. I really want to thank and appreciate all the students who worked on their research projects. And these research projects, we are putting seeds into these students, yes, and it helps them as they get to know the research steps. And as they do the research, as they go out into the community later on and they graduate, they get some good jobs later on too.
Yes.
So that is I'm very appreciative of the faculty mentors also who take the time to do all the work with them.
Yes, and I would like to thank LSAMP and HBCU programs that's sponsored by the National Science Foundation. They helped to sponsor the research, fund the research that was done. So we will close out with prayer as we finish and end this symposium session. Bow your heads. Dear Lord, I just want to thank you for all that you've done. I thank you for allowing this presentation to occur. And I pray that as we continue at our institution to grow and to engage in more faculty scholarly activities, as well as research for students, that it may grow to be of your liking. Thank you once again for your blessings, I pray. Amen.
Amen. Amen.
God bless.